understand that if you have sleep apnea, you snore. There's no way you can't snore if you have apnea.
What if you don't snore?
Well, you probably mouth breathe and you may have one event an hour, two events an hour, and maybe you're just a real light purr. We call them a lot of women. We're the ones who purr at night, and especially, and that's a whole. We'll go into that in a bit. But the issue is I treat a medical disease when I treat sleep apnea. So I don't just throw an appliance in everybody's mouth.
You need the diagnosis.
You need the diagnosis if you want to treat your sleep apnea.
6-9 foot pursuit. Stop! Sure! Stop!
Very much. Thank you for coming to our podcast.
Well, thank you for asking me.
Today, we have the privilege of having Dr. Van Dyke, who is a dental sleep medicine and TMJ specialist who is certified on 3 different boards.
Yes.
Excellent. Can you give me a little bit of background on your education history and your employment history?
Well, I was a dentist first. I graduated in 1990. So that's been quite a long time ago at this point, 34 years to be exact, that I graduated from dental school. And I was a dentist for 27, I think, of those years. And I started into the path of studying dental sleep medicine and TMJ, or facial pain, if you will. It's another way of looking at it. Um, Probably halfway through my career as a dentist, started education towards those things, and then became so engrossed with it, passionate about both of these things that stepped away from my dental practice to just do this. And so I've been doing that now for um, 5 years directly, but started my office approximately 7, 8 years ago here in Great Falls for the TMJ and dental sleep medicine.
Okay. And you see patients that are struggling with facial pain due to sleep issues? Can you clarify a little bit more on that?
Well, there's two types of patients I see. I see the sleep patient that doesn't have any pain. Very often they're like a CPAP failure patient. CPAPs are probably the most common way that we treat sleep apnea issues. Um, Most people have heard that word nowadays, and then most people have heard of or have a friend or
Mhm.
somebody, family member who's wearing a CPAP. The trouble with CPAPs is about statistically 50% of everyone who gets one fail. So then the next form of treatment comes to me as a dental sleep medicine specialist, and we treat with oral sleep devices, oral sleep appliances. Um, the difference is a CPAP, there's different types of masks that blow enough air pressure either through the nose and the mouth, or just the mouth to blow the airway open, kind of like a balloon. And it's very effective. It is considered the gold standard. And I have nothing against CPAPs. They are needed. And if you can wear them, hallelujah, because it can help you tremendously with your sleep, your energy levels, all of those things. But the statistics are 50% who get one can't wear it, discomfort, claustrophobia, air in the stomach. There's a lot of different things that happen to people, sinus infections. And so then there's this other form of treatment, which is considered through the medical world as secondary treatment as an oral sleep device. And it's best provided by a dental sleep medicine specialist who's had a lot of extra training, because anytime you're going to put an appliance in somebody's mouth, um, you need to be able to assess the mouth and the joint before the TMJ joint, in other words, before you put an appliance in somebody's mouth. And so that's why the two things kind of go hand in hand. But there's these patients who have no pain,
Mhm.
who just have the sleep issue, or they may be a mild to moderate sleep apneic, which we can talk about what qualifies you as each of those things in a little while. But mild to moderates actually can choose an oral sleep device over a CPAP first if they want to. And quite honestly, you can choose an oral sleep device anytime you want to as first choice if you want to. It's just that I also recognize that people who are severe, they've got a lot of, we call them comorbidities, things like heart problems. Um, they may have atrial fibrillation, very common. Um, they may have coronary artery disease, things like that. And, high blood pressure, very common amongst sleep apneics. And so I value that. I mean, we're treating a disease that can kill you. And so I want the best for every patient as well. But if they fail with the CPAP, then that's where I come in with those people. If you're not severe and you don't have, a lot of comorbidities, diabetes, that's another one. People with diabetes. I've always been told it's, of the 10 diabetics that walk in the room, it's more like which one doesn't have sleep apnea. Most of them do. So there's these correlations between chronic diseases and sleep apnea. And high blood pressure is a big one. Diabetes is another big one. Um, and so that's the type of patient I see that way. But then there's this other type of patient, which is a pain patient. I refer to him as a pain patient because there's a lot of different forms of pain that come off the whole temporomandibular disorder dysfunction. Docs, meaning MDs, and pretty much anyone else out there, you hear the word TMJ. I have TMJ. Well, what does that really mean? Well, it actually means you have two TMJ joints, temporal mandibular joints, that are attached to your jaw joint, in other words, right? And we all have two of them. And it's the dysfunction of that I treat, which comes in the form of many different symptomologies. The most primary symptom that a TMJ patient has, and I'll just say that because even though it's really wrong to say a TMJ patient, it's really temporal mandibular disorder, TMD. A
Okay.
TMD patient, the primary symptom is cervical headaches. So neck, cervicogenic headaches, we call them. And that's one of the most primary symptoms that these patients have. And these people have usually been 3 or 4 doctors before they get to me, and they tend to get to me sort of accidentally because the world of TMJ is such a mystery to all the doctors out there because of, I don't know, probably lack on the dental side part of educating. And I am working on that, trying to educate my community in what I do so they know when to send people over. And more, it's getting better that docs are referring more people because they recognize, hey, they'll just say, hey, sounds like you got TMJ. You should go see Dr. Van Dyke. And so that's happening more and more for me, which I appreciate because I love what I do. I'm extremely passionate about it and just want to help everybody. So.
Good for you. So how would a person know that they have TMJ though? Is just pain in the jaw or, the headaches? How do you know when to seek help?
Well, okay, so primary symptoms, different things that come up are certainly a headache and especially a headache first thing in the morning. If you wake up with a headache, it's either because you've been clenching all night and it's a muscle tension headache, or you also may be having a hypoxic headache, meaning you have apnea that's causing lack of oxygen to your brain, and that's causing the headache. So it's either one or the other, or it might even be both. And so that's why I end up, seeing headache patients that nobody else has been able to help completely. They might have got a CPAP for their apnea, but they still have a morning headache because they're still clenching, which in theory they shouldn't be because the oxygen levels are being controlled with that CPAP. But I get a lot of these CPAP wearers that have facial pain issues. I've got a guy right now who's been everywhere, and we've lowered his headache issues by about 70%. So it's not that I always cure everybody 100%, but what I tell people is like, we might have different levels of success, and I don't know how much your clenching is playing into that headache, but we're going to find out by treating you, by giving you a proper appliance at night. And if they already are wearing a CPAP, that better be an airway centered appliance that's not going to hurt their airway. And that really is an oral sleep device. You just wear it with the CPAP and it's called cotherapy. But they're there seeing me not for the apnea at that point, because that's being controlled under the CPAP. They're there for the facial pain problem. So that's why you see this, the name of my business is the TMJ and Sleep Therapy Center in Montana. You have the non-pain patients that show up with the airway stuff alone that we treat with the oral sleep device. And then you have the pain patient who doesn't often know
Mhm.
that they have an airway problem, but they do. And it isn't always apnea. A lot of times it's an under the radar apnea. And this brings up the whole thing we were talking about in the beginning. I said we'll talk about that later with um, mild. When you're qualified as an apneic, you're either called a mild, moderate, or a severe. And that's quantified by a sleep test, which you can do in a lab, which is always best. An in-lab study is always best. But nowadays, insurances and whatnot are liking the home sleep test better. And patients do too, because you can take this test in your own bed. And honestly, going in lab, it keeps a lot of people from going to even get the test because they don't want to go in lab. And so, when I talk with people, I make sure they know there's an option. And that's part of my phone calls. It's like, let's talk about what this takes for you to get treated. Do I think you need to get treated? And when you talk to your doctor, what do you need to tell them so that you can get a sleep study? Because I don't provide the sleep tests, um, and I do not diagnose sleep apnea. The sleep doctor has to diagnose it from a proper sleep test, and that's provided. We've got several in town. We've got Benefice Sleep Center, and we have Rocky Mountain Sleep Disorder Center, and they both provide in-lab studies for patients, and they provide home sleep tests where you go to the lab, you pick up the home sleep test, they tell you how to take it, you take it home, you put it on. It's actually very simple, and you can do it from home, and then that gets read by the sleep doctor, who then diagnoses you as mild, well, as nothing, or mild, moderate, or severe. And that comes down into, well, what does that mean? Well, it's these airway events that qualify as an apneic event. And you get this number or this label of how many events per hour the machine recorded that registered as a true apneic event and is counted. So you might have we call them AHI number. It's your apnea. Apnea means your throat closed off completely. So you're not breathing at all. Hypopnea is the next choice, which is a partial closure, usually at least 70% closure of the airway, or collapse, if you will. Or I like to use the word suffocating because that's really what it is. You're suffocating. You're not getting proper oxygen and or carbon dioxide levels are both being screwed up. And even a partial closure, or the thing I'm calling a hypopnea, creates a desaturation with the bloodstream. And that's what the lab is measuring, is these desaturations. And for how long they're happening. I mean, some people can literally quit breathing for up to a minute. And there is nobody out there, unless they have trained, to not breathe for a minute. Think about that. Neither you or I sitting here could probably hold our breath for a minute if we tried right now.
And that could be several times through the night.
More than several times. And that it can be more than, well, if it's a minute, you only have 60 minutes in an hour, so you got to breathe sometime. And for most people, it's maybe not a minute, but it's long enough. It has to be over 10 seconds. And you have to have a desaturation of the oxygen level by 3 to 4% for it to be called an apneic event or a hypopneic event that get both counted because they both cause a desaturation. And so then that's what they're measuring. And they put you into mild, moderate, or severe. If you're mild, you have to have at least 5 events an hour to be in the mild category. And that goes up to 15. So 5 to 15 events is considered a mild sleep apnea. 15 to 30 is considered moderate, and anything over 30 is considered severe. And, pretty much if you go get a test, most of the time you will only be offered a CPAP, mild, moderate, or severe. But more and more doctors are, like I said, getting aware of what I do. And I do get referrals from the sleep docs. And so they do appreciate what I do, especially for their CPAP failures. But there are some people who go in for the test in the lab and they find out they have apnea, and then they put a CPAP on them in the study even to see how they, if they can correct it with a certain pressure pushing through that mask to see if they can correct the apnea for that patient in the same night. Or they'll have the study identify that they have an apnea level of some kind, then they'll go back for what we call a titration study with just the masks, and the technician will work with them all night to get the pressure just right to cure the apnea. And like I said, CPAPs will usually cure it most of the time. They can get enough pressure in there to stop it. So, but it's all if you can tolerate it. So,
Can somebody who has these symptoms when they wake up in the morning just go to you directly to get those devices instead of going through the whole gamut of the sleep study and starting with the CPAP?
no, they can't. I won't treat someone with sleep apnea without having a sleep study. Understand that if you have sleep apnea, you snore. There's no way you can't snore if you have apnea.
What if you don't snore?
Well, you probably mouth breathe, and you may have 1 event an hour, 2 events an hour, and maybe you're just a real light purr. We call them, a lot of women. We're the ones who purr at night, and especially, and that's a whole. We'll go into that in a bit. But the issue is I treat a medical disease when I treat sleep apnea. So I don't just throw an appliance in everybody's mouth.
You need the diagnosis.
You need the diagnosis if you want to treat your sleep apnea. Now, if you want to come to me for a snoring device, you can. I'm going to still have the conversation with you about, hey, you really should have a sleep study. But if we're doing a snoring device, and that's so rare, I just don't treat, it's rare. I'm just treating snoring. So rare.
If you're snoring, you may have sleep apnea.
Oh, yeah, especially guys. Men are, until a woman reaches 50 to 55 in post menopausal point in life, we become equal with men at that point as to how many of us have apnea. But before that, men are at least 2 to 3 times more likely to have apnea before a woman does over 50, or 40, between 40 and 50 it can start for a woman. I was about 47, so I'm a sleep apneic. But I'm mild. I have 7 of these airway events an hour that qualify, or I suffocate 7 times an hour. And I wear an oral sleep device because that's how I choose to treat my apnea. And I have had a post study to make sure that my apnea is controlled, which is, for me, I like to get everybody under 5 events an hour. Do I get everybody to 0 with an oral sleep device? No, I don't. Some I do, some I don't. In the medical world, I'm considered successful if I lower that AHI number by 50%. So if I'm a 7, which is what I am, if I lower myself to 3.75 or 3.5, then I'm considered successful in the medical world. If I lower you from 88 to 44, I'm considered successful. And I'm always trying to do better than that because we can manipulate these devices both vertically and horizontally, meaning bringing the jaw out to open the airway. So an oral sleep device works by structural movement of the jaw. Because when the jaw is moved forward and or opened, there is an increased muscular tonicity in the throat or in the airway. And that's how they work versus the CPAP that we talked about earlier with the air pressure. So they're totally different things.
What if somebody has sleep apnea, they're snoring every night, and they do nothing about it, and 20, 30 years pass?
Well, there's my dear mother who passed away almost 2 years ago at 93. I know she had sleep apnea. She wouldn't get diagnosed, but I'd seen her sleep enough over the years, and she definitely quit breathing in her sleep, snored very loudly. And, she lived to 93. So are we to sit around and say, well, if you have sleep apnea, you're definitely going to die? No, we can't do that. But what we do know is that statistically, sleep apnea will take 10 years off your life. So if you have it, there's a good chance that you might not make it to 80, you might die at 70. And people die from things like strokes. And that's, so we could go into the physiology of why apnea causes health issues. And that's because when you have an apneic event, you're not breathing. So your oxygen levels are being lowered. So your cells of your body are getting less oxygen in that moment. And if that's happening 5, 10, 30, 50, 100 times an hour, you're not getting proper oxygen. So there's that. Could that produce some chronic disease or your body to break down in some way? Yeah, it makes sense because we can't, primarily the order of health is breathing first. So oxygen first, proper oxygen and proper carbon dioxide levels first. Then it's actually water, and then it's food. We can live 3 or 4 weeks without food. We can live 4 days without water, maybe, and we can't live more than 3 minutes
Without oxygen.
without O2. Yeah. So when you look at it that way, it's a big deal. It's the starting point of life is oxygen. And when you have these events and you're not breathing, the heart goes through a whole thing. So this is how a lot of people with apnea develop high blood pressure. The heart, so when you're not breathing, there's a negative pressure created in the chest cavity. And that negative pressure basically makes the heart negative pressure and the oxygen levels. Got to get this right. I know there's some MDs out there listening to me. so, so the oxygen levels are dropping off, right? And the brain knows that because it's constantly sensing. It's like a computer.
Mhm.
It's sensing the levels of O2 and CO2 in the bloodstream all the time. And you will either breathe faster to make up for it, or if you're don't have enough oxygen, your blood vessels are going to constrict, which is high blood pressure. The vessels will constrict in order to push the blood around faster. I always say it's kind of like you have two big, garden hoses. You got one that's really big, maybe 3 inches wide, and you got one that's an inch wide. Well, which one has more pressure running through it? Well, the small one, right? So the more your vessels constrict, the higher your blood pressure is going to go. And then high blood pressure works on the vessels over time and creates thickness. And then it gets rough inside. We call it the endothelial layer of the blood vessel. And it gets rough in there from this constant high blood pressure, no low blood pressure, the movement of the blood. And as the vessel wall goes through this night after night, year after year, then the vessel becomes rough, and now plaques and or cholesterols, the bad cholesterols, and I don't remember if that's HDL or LDL or what it is, but I just know that they are
There's
more
good-
attracted to these rough spots. That's where you get these, they call them plaque buildups in the vessel. Well, then as you're an apneic and you're going into these high blood pressure moments, if that vessel happens to be in your heart and it constricts and now you have a plaque in there, guess what? Now that part of the blood isn't getting any blood because the vessel just constricted on the plaque and now it's closed. And you very often, people who die in their sleep statistically died of sleep apnea.
Wow.
It's very
Interesting.
common.
And even at the minimum, they could just prolong a disease they have because they're not getting help for it. When you're talking about people snoring,
Mhm.
I've noticed it seems that when people gain weight, they snore. Now, does weight gain contribute to sleep apnea, or can it be reversed because we lose weight? How do those two interact?
Great question. So sleep apnea contributes to weight gain
Oh,
because it messes with your hormones. It messes with your so insulin resistance issues. Okay, that's a big deal right now. We got all these diabetic drugs out there now that people are using for weight loss, and it's great. But if you lose 10% of your body weight, so let's say you're overweight by 50 pounds, maybe you weigh 250 and you lose 25 pounds, your apnea levels can drop by 10% at least. So losing weight helps apnea because there's a fat pad at the back of the throat. And the bigger your throat is, the bigger the fat around your torso, chest area, the more pressure there is when you're breathing. And the easier it is for the throat to close off. So when you lose weight, all those things shrink, and that's why
Interesting.
apnea can get better. But then you have us women over 50, postmenopausal women, which that's me. And what happened, and I'm thin.
Mm.
I don't have a big neck. My husband is always teasing me that I have a giraffe neck. I got this long, skinny neck, right? Why do I have apnea? Well, I have apnea because I have really low progesterone levels at this point in my life. That's one thing. And I also anatomically have stuff about my jaw that are conducive to my jaw falling back, and therefore my tongue with the jaw falling back and closing off my airway. And I didn't actually probably start snoring till I was around 47, 46, 45, somewhere in there, and got diagnosed with the mild sleep apnea when I was around 48. And I had a lot of other things going on at that time. I was a dentist full time at that time, and I was doing this stuff. I was treating some sleep apnea patients, some craniofacial TMJ type patients at that time in my dental practice. And all of a sudden, I became one of them. And what it was primarily for me was a lower backache. And you say, well, how's that related? Well, so when you sleep with apnea, you can have what we call restless leg movement, restless leg syndrome can happen. Sometimes that's due to low iron levels, too, by the way. But I'm sure I was moving in my sleep, and I also was in this extremely postural job, right? Dentistry. I mean, you're like
Leaning
bent over,
over.
yeah, people all day, right? And so most people would say, "Oh, it's because you've been a dentist for 25 years, or however long it had been at that point." And it was funny because it took me a while to identify what I was doing that was causing my backache, and I hadn't been diagnosed yet. But I got diagnosed, and then about the same time, for whatever reason, I identified that I was mouth breathing under my mask all day. My mouth was dry all day long, and I didn't get it. It suddenly dawned on me because I talk about mouth breathing a lot with my patients. It's so detrimental to the body.
Dries out your mouth. It is very unhealthy to mouth breathe. You're supposed to be breathing through your nose.
Exactly. And but what else happens posturally when you mouth breathe? Your body leans more forward.
Your diaphragm is caved in and you're not
Exactly.
getting full breaths. You're not getting oxygen to your body. Helps you think clearer, helps you respond.
Exactly. And so here I am working as a dentist posturally, bad job posturally, for 25 years at that point, I think around then. And um, well, actually, it was before that. Probably would have been 22, 23 years when I identified that. But um, the mouth breathing, so I implemented some of my nasal protocol that I do with my patients, because it's not just about giving the appliance, it's also about identifying the nasal problem that everybody that I see has. And it may just be swelling in the nose, it might be a deviated septum, it might be what we call, I see a lot of nasal valve collapse, the most exterior first point of entry of the nose collapsed. And I had nasal surgery back when I was 44, which collapsed my nose. And I kind of feel like maybe that was a contributor too.
Hmm.
Probably wasn't all of it, but so I identified that. And I started putting these dilators, these little nasal dilators in my nose, and then I wore a little appliance that I have. It's a temporary appliance, but when it's in your mouth, you have to breathe through your nose. And so I put those things in, put my mask on, and went back to work. And it's an emotional thing for me because at that point, I had experienced. I was at the point for about, I don't know, maybe a year at that point when I identified this. I had a constant lower backache. And and then I was starting to get a catch in my right hip, like it was catching when I was walking. And I also noticed my gait was changing. And what's interesting about that is that's sort of becoming a movement disorder. And I was just breaking down. And one night I came home from work and I looked at my husband, I'm like, I don't think I'm gonna be able to do this very much longer. I'm just like falling apart. I couldn't run anymore. I've been a runner my whole life. I was pulling my muscles. I had to give that up. I hadn't ran in a year at that point, and So then I identified this stuff, right, about myself. I'm like, I need to get a sleep study. And so I got the sleep study, found out I had a 7 AHI or mild sleep apnea. And I fixed my mouth breathing during the day and at night with the appliance and taping. That's a real thing. People look at me and go, "What?" Taping? Taping's a real deal. You look it up on the internet. A lot of people are taping out there. They
What
have a
is taping?
taping is taking a little piece of tape and putting it over your lips at night so that you have to nasal breathe.
What if you don't have the device for your nose?
If you have a bad nose, you will never be able to do it because your brain will wake you up and you'll think you're suffocating. So this is part of what we do when we assess a patient for a sleep device and or a TMJ patient, doesn't matter which, because they both have nasal problems. And so I identified those things, and I was also the thing I didn't tell you is I couldn't roll over in bed anymore because when I tried, my lower right sciatic hip area would catch and it would send this shooting burning pain at my back. And I don't know why. Well, I do know why, but I can't quite tell you the whole physiology behind it. But when I put that oral device in, it has, when you move your jaw, you have an effect on your cervical spine or your neck, right? And what's happening at your neck, it's connected all the way down to the tailbone, right? I don't know what it did, but all I know is I could roll over without any pain instantly the first night. And everyone looks at me and goes, I'm dead serious. I take a lie detector test to that. It's the weirdest thing, but it solved that problem for me. And then my lower back pain was 75% reduced within 2 weeks of implementing the daytime nasal breathing stuff while I was working. I mean, my girls will attest to this at the office. I mean, I would get up so slowly out of the chair because my back hurt. And the other 25% was what I was eating. Sugar, dairy, gluten. And for me, sugar being the worst. To this I mean, I had to cut back. And I'm human. I don't care if I'm a dentist. I like food. I like sweets just as much as the next guy. But my diet was terrible at that point. And so I cleaned that up. And quite honestly, when I got rid of the sugar in particular, my back felt 1,000% better. So that last bit of inflammation was due to what I was eating. And there's lots of people out there, you know, nutrition has become a bigger thing, natural nutrition, certainly in our world today. People are talking about it a lot more. Um, Nutrition, you can heal yourself through good nutrition in a lot of different ways. And so if I pay attention to that, pay attention to my nose and what I'm doing with it, I don't have back problems anymore. And I
Mm.
did actually have a true injury in my lower sciatic when I was 25 years old. So there was something there that could get worse through all of those other things that were going on. But I really don't think about it anymore. And I can run. I started running on my treadmill. Like when my back felt better, I thought, I wonder if I could run again. So I got on my treadmill, put my dilators in my nose,
Because it's when you're running, you should be breathing out your nose. And
but nobody does.
but yeah, it's
Not unless they've trained to do it.
hmm
And if you have nasal valve collapse, there's no way you can do it if you don't open up your nose a little bit because you can't get the volume of air, the oxygen demand that your muscles are demanding in that moment of exercise. So you do need more airflow when you're exercising, but you can get it through your nose if your nose is open enough.
hmm
And then work at it. You can slowly work into it over 2, 3 weeks to where I can run like a 12-minute mile. I'm not a fast runner by any stretch of the imagination, but I can run a 12-minute mile with my mouth closed. I'd say 90% of the time that I run. So, yeah, it's a big deal. And I healed myself.
you healed yourself. So lifestyle changes can add to the success of these devices.
Mhm.
Loss of weight. What about a consistent sleep routine?
Oh, yeah. So, one of the problems today is we're all on these devices, meaning our phones, our computers. We don't shut down. We're looking at a computer screen or a phone right up to bed. And you've probably heard of blue light.
I would love to ask you about the
Oh
colors.
yeah, blue light's a big thing, and you've got to shut that down. Ideally, honestly, if everyone would put their phone down and not look at it again after 6 o'clock at night, that alone would help a lot of people and their computers and everything else, right? And food too, by the way. You do not want to eat too close to bedtime.
What time? How long of a time frame should there be between
Ideally,
eating and
3 or 4 hours at least
3 or
before you
4
go to
hours?
bed. Yeah. And
So
dairy's a really bad one to eat before bed because dairy can make your nasal tissue swell. And because a lot of people have sensitivities to dairy, and a lot of people have sensitivities to gluten. Once you get in tune to your nose, it's funny. I mean, I've been out to eat or I've been out for drinks with friends or something, my husband, and it's like I'll get a drink and I'm like, what just happened? I feel like I have a cold. My nose just sucks up. And I'm talking nasally and I'm like, I wonder what that drink had in it, but something. And some wines do that to me. Sometimes a White Claw will do that to me. It's and maybe not every single time, but you can definitely tell within about 10 minutes of starting to drink or eat certain things, there's some kind of response going in the nose. In fact, the nose is the first place. It's the most sensitive part of your body for swelling. So if you have a sensitivity to something, it usually shows up in the nasal tissues first.
what is your opinion on, and I know I'm going to say this wrong, nasal, when you clean out your nose,
Oh,
that like the
like a
little pot.
neti pot?
Yes.
Neti pot? It's a great idea. I tell a lot of my patients to do that.
How
Start there.
often?
Well, it depends on how bad it is. I just happened to actually, it was kind of interesting. I saw my daughter just last week, and we took a CBCT on her. That's a special X-ray that we take to look at the joint, TMJ, and the nose. Um, it's not near the radiation levels like 4 bite wing X-rays from a dental practice. It's not like what you're getting as a CBCT in a hospital, but it shows me the nose and it shows me the TMJ joint. So I can look at what destruction is there, or if the sinuses are full, or if there's these things in your nose called the turbinates, which are very often swollen from either allergies, sensitivities to food, who knows what it is, right? Or even mouth breathing can produce a swollen nose. And that comes because of carbon dioxide levels being out of out of whack, so to speak, and the body's just trying to that's a whole nother conversation.
Can somebody who just got x-rays from their dentist, would you be willing to look at those as part of an evaluation?
No,
Okay.
no. I need my own X-ray. CBCT is a 3D image. So it's not a 2D image like a panel X-ray. Panel X-rays are very common in dental practices. They'll show you the whole arch from one side to the other. You can see the wisdom teeth. You can see the TMJ joints on each side, but it's really not
It's
diagnostic.
not what you're looking for.
No, I need to see it in
The
3D
nose.
and the nose as well. And we look at that and then we identify where the problems are. And I'm not an ENT. I'm not diagnosing, but I understand it enough through my training to know what a good nose looks like from a bad nose. And I'd say 30 to 25 to 30% of my patients actually need to go see an ENT. They've got deviated septums, things are so swollen, they need to have reductions done in the tissue to open up their nose. They need help with their nasal valve compromise that's going on. Um, and so I will refer them to the ENT to have those things looked at. And I just list the things that I see that I suspect. I'm not diagnosing. I'm just, I see these things and I suspect these things are going on. And would you do a consultation with my patient type of thing? So I'm very respectful of my MDs and what they do. That's not me. But I do know enough because, and it's great that I do, because if my patient has a nasal problem, I will never get them to full success with their oral sleep device. And even with a good nose, statistically, I do not solve everybody's problem with an oral sleep device. And I tell people that, but I do very often, meaning I'd say 90% of the time I do get their AHIs down by half, which, I have a gentleman right now who's an 88 who I've gotten to a 33 and he can't wear a CPAP. So is that a good thing? Yeah, it's not perfect success, but it's a lot better. Not breathing 33 times an hour is better than not breathing 88 times an hour because that's more than once a minute if you think about it.
When
So,
when this is happening through the night, how does this disrupt the all the different sleep phases that you're supposed to go through for
uh,
a healthy and whole sleep?
yeah, that's a big thing. So, there's 4 stages to sleep, and then there's the first stage, we call it N1, N2, N3, and N4. And N3, or deep sleep, is important for the body. So, like healing of the body. If you exercise a lot, um, especially an athlete, but it doesn't matter if you're injured with an injury, you won't heal properly if you don't get good N3 deep sleep. Then there's REM sleep, which stands for rapid eye movement sleep. And that's where we dream. And very often people with sleep apnea don't dream much. They don't get into REM well. And a lot of times that's because in REM, that's when we don't act our dreams out because we're paralyzed. There's a paralysis that happens to the whole body when we are in REM sleep. And that's a good thing. Otherwise, we'd be acting out our dreams. And there are people who have REM sleep disorders who are acting their dreams out, and they shouldn't be. And a lot of times that's due to low, what we call dopamine levels in the brain, which relates to Parkinson's patients and different movement disorder patients. And so sleep's a big deal. People with REM movement disorder very often end up as a Parkinson's patient eventually. And that's a scary thought. So sleep's a big deal.
I'd like to ask you a little more details on that.
Uh-huh.
If you're having a nightmare and you're screaming out in your sleep,
Mhm.
is that what you're talking about? If you're moving your arms and legs,
If you're
fighting something?
yes, if you're really moving, you shouldn't be. And so if you move a lot in your sleep, you do have there's different levels of that disorder, right? Some people really act it out and others not so much, but some movement. And then there's the things called PLMs, periodic leg movements, that happen too. And all of that can be disruptive to your sleep. And the apnea alone, if you have apnea and you're not breathing, that wakes you up, but doesn't wake you up completely, but it's throwing you in and out of those stages of
That
sleep.
you need for healing.
Exactly.
What about
So it's super damaging. What's that?
Sleepwalking.
It's another sleep disorder, another form of a sleep disorder. So, when you see those things in children, I mean, we haven't even got to
Night
talk about
terrors.
kids, night terrors, sleepwalking, children that are, ADHD. This is becoming another huge passion of mine is these kids, and
You might,
really just at the tip of the iceberg.
you might have to move there.
I
you
need to
go.
move closer. Okay. These kids, they have these same sleep disorder issues as adults, and like I said, you can't judge a book by its cover because you can be thin, you can be overweight, and you can both have apnea.
As a parent, what should we be looking for in our kids sleeping?
Well, if they're snoring,
Okay.
and I don't care who it is,
Loud
adult or
snoring.
child, snoring shouldn't be happening. Number 2 would be very active child, on the ADHD spectrum, busy, having behavioral problems. Some of these kids have ODD, uh, obstinate defiant disorder. They have really hard time with transitions, getting up in the morning, getting ready for school, going to sleep. They'll just fight the parent. They can be very ornery children. They can be the bully in the class, frankly.
And this could all come back to their sleep.
Yes. And those people turn into adults. They're the friend of yours probably with the bad attitude all the time. Honestly, it's like you think about if you don't get good sleep your whole life, do you feel good? Do you feel like a happy person? Probably not. And it affects brain development too. Um, Children, I mean, that's where it's biggest in a child because if the brain's not developing properly because not getting enough sleep, it can't develop properly. So, behavioral language, behavioral aspects, all get disrupted, and these children literally don't feel well. They just can't voice what it is. They don't know what it is. They just know they don't feel good. And so they act out and they have behavioral issues with their siblings and or friends or parent. Um, I spoke with a man a couple weeks ago, a patient of mine who told me his child was having behavioral disorders. And I just happened to talk to him. It was out of the office. And I said, "How are you doing?" He said, "Well, not very good." And I said, "Well, why?" He said, "Well, my kid's having problems." And I'm like, "Well, what's going on?" And he told me that his 12 or 11-year-old, I believe, hit his teacher. And I said, like, "Well, what's his sleep like?" I said, "Does he snore?" And he said, "Yeah." And I said, "You need to get a sleep study for that child." And, you know, but that doesn't happen. This isn't talked about enough.
I gotta tell you when you're talking, I don't know if you know what cytomegalovirus is, but
No.
it's a virus, and if you can get it as an adult, but you can also, if you're pregnant, pass it to, and you get that virus, pass it to your child.
Uh-huh.
And it causes extreme lack of, like, just, they don't sleep, these kids.
Hmm.
And my daughter was born with that. Not one time has anyone ever said anything
About a
about getting
sleep
her
study?
getting a sleep. And we saw 100 specialists. We went to hospitals out of state to try to help her. Not one time. So this is just fascinating.
I'm telling you, it's not talked about near as it needs to be talked about a lot more.
So when if you go to your doctor and you ask for that, they're going to go, why?
Because of behavioral issues,
Yes.
because they snore and they should never snore. No one really should snore. Yeah, that's the funny thing in society. "Oh, I just snore a little bit. It's not a big deal. I just snore a little bit." People say that to me all the time. I'm like, actually, it is a big deal because you have a headache every morning and you're clenching your teeth because of it. And you know what I mean? You're sitting in front of me because you have an airway problem that nobody's diagnosed. And that's why you have a headache every day, probably, And so and these kids, another friend of mine, kind of funny how things go, but the child has very extreme ADHD, been a neurologist in the state. Nobody suggested a sleep study. I was horrified, and I'm horrified by this all the time. But it's young. Understand that it's children's sleep apnea and how to treat it. The only way they're treating it right now, mostly, is with a CPAP. Well, a CPAP on a child's face is a really bad thing because it's a growing face and it stunts their facial growth. And as they wear the CPAP longer and longer, it makes their apnea get worse because the face cannot grow forward and therefore the airway can't open up because the nose is closed and narrow. The palate develops high and narrow, and that's the floor of the nose. The back of the throat does not develop properly because the face is being held back from growing forward. So it just stunts facial growth. So it's a terrible thing. But that's really all they've had till now. Now we're doing, and some orthodontists are working with this too, not near enough, in my opinion, and I'll say this out loud. Every orthodontist should evaluate airway first. And I don't care if they don't like me because it's a big deal. And these children have to be evaluated. And I have started actually treating some of these kids myself through training that I've gotten special to develop the face. But I do not treat a child, I'm not an orthodontist. I am treating the airway. I am orthopedically treating the airway. What happens to their teeth goes to the orthodontist. But very often their teeth get straighter as you get the airway proper, because then musculature of the face doesn't get. When you have an airway problem, a mouth breathing child develops muscular disharmony, both in the tongue, the way they swallow, the way the cheeks pull in, and it pushes the face, it pushes the dental arches closed and narrow, which creates crooked teeth and high, narrow palates that need to be expanded. But lateral expansion isn't all that an apneic child needs. An apneic child usually needs some forward movement as well to open up the back of the throat, not just the nasal cavity, which is lateral movement. And so this is all super infant state stuff that we're talking about. It is not mainstream. And I think eventually it will get there. like everything else in medicine,
Well, why do we not look at our children? I
well,
mean, why is it only that we're looking at, our husband snoring?
I agree. I agree. I
Let's
wish
start
I had
this
known
out.
this. I wish I had known it when my kids were little because they all have a form of an airway problem. My middle boy is definitely on the ADHD spectrum. He's doing great in life and all, but there's stuff about him that I know. I know he's the kid who had harder time in school of my 3 children. Reading comprehension was difficult for him. Very the more ornery of my 3 children, definitely. Um, but there's something there.
Whether you're into getting fit or staying fit or just having fun with the family, join the Peak Health and Wellness Center today. With 2 great locations in Great Falls, they're here to serve you. If you like weightlifting, functional fitness, or enjoy a wide selection of cardio equipment, the Peak has everything you need. They also offer classes for all ages and fitness levels. The Peak even has a daycare for those busy parents out there. Go check out the Peak today. The Double Barrel Cafe is all about you, the amazing people of Cascade County. With every purchase you make, they give back to our community. Every bite and sip fuels their mission. Let's make a positive change, 1 cup and 1 bite at a time, because the Double Barrel is not just a cafe, they're building a better community. If you haven't noticed lately, Cascade County is booming, and the choice for all your construction needs is Builders First Source. They even have an automated home builders solution for all of your construction needs. Go to 826 Northwest Bypass in Great Falls and check them out today. Are you looking to replace those floors in your home? Or maybe you're doing new construction? The place I trust is Contract Flooring Carpet One. This is a locally owned and operated business here in Great Falls, and they are committed to serving you and giving you the very best prices and the very best product and service. Go see Contract Flooring Carpet One today. You'll be floored. When deciding who I would trust for the technology component of this podcast, the choice was simple: Information Systems of Montana. Whether purchasing products for business or when I had them build me a new MacBook to catch child predators, they delivered, creating a solution for my exact needs. Contact Information Systems of Montana today. Everybody needs a good insurance plan. Whether it's for home or auto insurance, check out Heinbaugh Agency. Eric Heinbaugh is a local agent focused only on customer service, not sales. If you're passionate about firearms and the Second Amendment like I am, one of the best places in all of Montana to go is Mitchell Supply. Jim and Tammy Mitchell have been running this gun store for decades. They're major supporters of the Second Amendment, and they're major supporters of our community. And obviously, they're supporters of this podcast. For all your firearms needs, go check out Mitchell Supply today.
The lymphatic system, if I'm correct, will drain all the toxins and things that you've gone through the day, process that, help you make decisions in the future. If you're not sleeping through the night and if you're having these breathing delays, I assume that your brain might not be at its optimal functioning level. What are the toxins that your body removes at night? I've heard that a lot. I've read a lot about it, but what is it exactly?
Oh, man. I'm trying to think of the name. I don't know all those details. There is a name. It'll maybe come to me here as we're talking, but you're right. They're toxins that build up just from cell activity, neuron activity within the brain, right? The cells of the brain, the neurons. And if you don't get good sleep, that does not get cleared out at night. And then therefore, kind of brain fog, just not feeling good. Your memory starts to there's studies out there about Alzheimer's and sleep now.
Mhm.
These movement disorders I was talking about, from anything from Parkinson's, tics, you know what tics are?
Mhm.
Uncontrolled movements of the
Movements.
body. Very often, there's a gentleman who's passed away now. His name was Dr. Robert Stack, who I had the privilege of spending about 3 days with him in his office. He was an orthodontist out in Virginia. And this was way back when I first started with this stuff. Uh, because my TMJ patients wear appliances during the day. A lot of them do, day and night. The day we take away after about 10, 12 weeks. But the nighttime continues on because of the airway issue. And keeping the jaw safe from the clenching, grinding. We have to control all that to keep it healthy. Well, this gentleman found in his orthodontic treatment with people that by putting an appliance in some of these people, kids in particular, and or adults with tics, that if he vertically opened the jaw enough, a lot of times the tick went away. Isn't that kind of a weird thing, right? So there was something from the contribution of the vertical of the jaw not being open enough that was triggering something.
Hmm.
And then Parkinson's patients who have gotten better by wearing a decompression appliance, which is what I call the appliance I give my TMJ patients. That's a daytime appliance, but it decompresses the TMJ so it can start to heal. Because even when you swallow, your teeth come together. And when you're sleeping, they've identified that the unconscious brain allows for up to 5 times harder clenching than like you sitting in front of me now. If I asked you to clench as hard as you could, imagine being able to do that up to 5 times harder when you're sleeping. And
For a long time.
well, off and on, who knows how long you do it when you're actually sleeping, but off and on enough, that's what breaks the TMJ down. It's your nighttime clenching that breaks it down. Then it breaks down the ligament that's attached to the disc that's supposed to be between the bones in the joint, a lot like the disc between our backbones. There's a disc between the bones in the TMJ joint, in the jaw joint. And that disc starts to move around, and that's your clicking and popping that you experience. And sometimes it locks, meaning it falls off completely. And then the bone can't move forward because it's fallen off in front of it, and now you're locked. And you can't open your mouth more than 10 or 20 millimeters, and your muscles get tight. And then the symptomology starts in with a headache, and my face hurts on the sides, and my throat hurts, my ears hurt. I get a lot of patients with ear pain, ear ringing. When we start talking about the gamut of TMJ facial pain symptoms, headaches, ear ringing, throat, feeling like you have a foreign object in your throat. That's very often what we call the stylohyoid ligament that gets calcified from clenching so much. And it literally can impinge on the throat because your hyoid bone or your tongue bone sits right under the chin here, right? So it comes from here down to here on the inside. And if it gets calcified enough, a lot of times people will say it feels like a chicken bone in my throat. So there's a whole array. And then you can get trigeminal neuralgia. That's another thing I treat that people don't realize. Clenching and grinding can lead to that. That is a form of it's a misfiring of the trigeminal nerve, which is the biggest. Think about this a second. Of the 12 cranial nerves, I like to tell people it's kind of like you got a wiring system, coming off the main computer, right? And you got 12 cords coming off that main computer. Well, the biggest cord coming off that computer is the trigeminal nerve system, which innervates the whole face, muscles of the face, of mastication, eating, chewing, clenching. And basically, that nerve gets distorted by the clenching because that nerve, a branch of it, runs right through the TMJ at the back of the joint. So when you're compressing all the time at night, up to 5 times harder, then that nervous system can get, damaged. And then it starts misfiring. So maybe you're having a shooting sharp pain in your tongue when you swallow. Maybe you're having a shooting pain from the side of your nostril, backward, from your joint, upward, or down towards the cheek. Those are patients I see. Those are not my regular patient, but I do see those cases. And most of the time, just by decompressing the TMJ, identifying the airway problem that they don't know they have, treating that with a proper appliance at night to control the jaw, control the pinching of that nerve through the jaw system, we're able to help those people get well where nobody else could. All they got is meds. All they got is meds. If they go to the neurologist and you have trigeminal neuralgia, there's meds and there's surgery. And there is sometimes it's a brain impingement on the nerve out of the brain. That can be a form of trigeminal neuralgia as well. So trigeminal neuralgia isn't always related to clenching, but it's a lot. And I think there's a lot of people running around on meds for trigeminal neuralgia that have never heard that, hey, if you explored this, you never know, you might be able to get off that medicine. So,
Um, Speaking of medicines, what is your opinion on Tylenol PM, Advil PM, melatonin, sleep medication?
well, I like melatonin because it's natural, but it also needs to be properly given. And I think melatonin's a bit overdone at times. Um, yeah, the Tylenol PMs, oh gosh, there's all kinds of Lucenta. I'm trying to think some of the names, but there's lots of sleep medicines out there nowadays. But they also have their downsides. Some of those actually interfere in some of the sleep stages, meaning mainly N3 or deep sleep and REM sleep. Some of the medications can cause you to clench more that people are on. A lot of antidepressants really interfere with sleep, and can make you clench as well. Um, so, yeah, when people come in, I am looking at their meds, and I do not take meds away from people. I understand that. That is not my position. And it's not my position to do that as their dental sleep medicine specialist. But my position is to say, okay, the patient's pain is gone now. Let's say it's trigeminal neuralgia, and the patient's pain is gone because of the treatment I've given them. Then I'll reach out to the doc and say, hey, I really think it'd be great for you to be in control, but their pain's gone, and could we at least start a weaning process and see what happens? There's nothing wrong with that. The worst that can happen is pain comes back, right? But a lot of times they can wean off of it or wean down to a very low level compared to what they were taking and move forward that way. Even that's a better scenario. Who wants to be on meds your whole life? So, sleep meds in general, though, back to really your original question, is just that if you're having to take a sleep med to go to sleep, then you better have had a sleep study, because insomnia in particular is so highly linked to apnea. There was a big study done years ago. It was like 90% of the time, people who have insomnia have some form of apnea. I mean, that's huge, right? And, maybe they're staring at their phone. Maybe they're, I can't shut my brain off at night. Well, probably because you got your phone in front of you until you go to sleep. I mean, really, people like to, oh, I don't want to change that. Well, you want to sleep better or not? Because you got to think about some of these things. There's choices we have to make with good sleep hygiene, I like to call it. And even with your children. I don't like children sleeping in bed with parents. I don't, because it screws up their whole ability to sleep alone. There's behavioral stuff that happens with that. It is not good to sleep with your child in your bed. I'll just say it out loud. And that may offend some people, but
Well,
it's
I
not a good thing.
I
Regularly,
could speak from
regularly.
someone who's taken care of many children
Mhm.
and infants. It's good to feed them and put them in their crib. And then when they're hungry, feed them and put them in their crib, not put them in the bed because you cannot get them out of the bed.
No, no. Once you start that, it's bad.
Yeah, it's enticing. I know that it's sometimes encouraged with breastfeeding,
Right, right. Yeah,
but you will still have that fight later, and it will be a very hard fight because those kids want. That's where they think their bed is. I mean, how would you like it if someone took your bed from you?
right.
So,
Yeah. I used to let my kids, I have 3 children, and I used to let them come in about 6 in the morning. We were getting up anyway. I'd let them come hang out with us, and we'd watch VeggieTales or, whatever.
hmm
And that was our time, special time in the morning. But no, I never liked sleeping with my kids. They woke me up.
well, they kick and they're
Yeah.
all over the place. So, other lifestyle changes. I know that a lot of people want to get home from work and have a couple drinks of alcohol.
Alcohol's really bad. It's really bad for your REM sleep. Um, And yeah, I mean, if you socially drink that night, you're not going to sleep well. And guess what? You're going to snore more. You're going to collapse more because it's a depressant. Alcohol is an airway depressant, overall depressant, but it depresses your airway too. And so, You will not sleep good on nights you've had alcohol. Having wine right before bed isn't really the best idea. Have it 3 or 4 hours before bed with your dinner if you want to have a glass of wine or whatever it is you like, but not right before bed. It's just not a good idea. It's not part of good oral or part of sleep hygiene, great sleep hygiene.
And caffeine is I mean, I need my caffeine in the morning. I recently read an article that recommends if you have afternoon crash, which I always do, to wait 90 minutes to have your first cup of coffee after you wake up because that will avoid the afternoon crash.
Hmm. Well, I'm not aware of that, but maybe there's something to that.
Like the caffeine will
It'll
last
stay with you that long, is what you're
instead
saying.
of it all wearing off at 2
Yeah.
and people want to take a nap
Mm-hmm.
if they can't. I mean, most people are working, but
Mm-hmm.
what do you think about naps during the day?
If you need a nap during the day, trust me, you've got an airway problem. Something's going on. You should not, we poo-poo everything. Oh, I'm getting older. Oh, I need a nap now. Oh, no, you don't. You can have great energy till you're an old lady. But good sleep is part of it. And taking care of yourself is part of it. What you're eating, drinking, all of those things. So I do not play into the excuses of I'm getting old. I should be tired. Oh, I take a nap every afternoon because now I'm 70. No, you shouldn't need a nap. You
Well,
really shouldn't need a nap. So there's something going on if you need a nap every day.
interesting. What would you say to the person who wakes up tired? They don't have snoring. I mean, no, not everybody knows.
Right. So there's a great way to find out. Let's say you don't have a bed partner, or you really don't know what you're doing in your sleep. Well, you don't want to do this with a bed partner who snores, or you won't know what you're doing. So you either get into a bed where nobody's there but you, or if you're alone and you don't have a bed partner, we all have an iPhone. So there's a thing called Snore Lab. And I work with this with my patients. Once I start them on an oral sleep device and we're working towards, curing or making their apnea better, whichever it ends up being, right? We use Snore Lab to put by the bed. It's an app and it will record you and it will give you a snore score. And it's great for people who say, "Oh, I don't snore." Well, let's find out. Put that phone next to you and turn it on. And if there's nobody else with you, it's just you, we're going to find out what you're doing when you're sleeping. You'll hear the heavy breathing, mouth breathing, you can hear it. Or you'll hear the snoring or light snoring and it records you and it'll give you a score. And, sometimes it's epic. Epic snoring usually is over about 60 decibels, and so um, the louder you snore, there have been studies that show it correlates to apnea.
Well, and I don't
More
even,
likely you are to have apnea.
I just want to be the best possible person I can be during the day. If I don't snore,
Mhm.
but I have an airway problem anyway.
Oh, yeah. You could have women a lot of times have what's called upper airway resistance syndrome. It's a very mild form of apnea that, in other words, if you had a study and you showed 1, 2, or 3 events an hour, even 4, then you don't qualify for any treatment. You only qualify for treatment if you reach 5 events an hour, which is the lowest end of the mild, right? But a lot of the milds, what I find is they're the most tired people of all. And I don't know why that is, because you can have somebody who's having 50, 60 events an hour, and they'll say, "I feel fine." So clinically, they're not presenting like this tired person that you would think they would. And then the people who are on the mild scale are super tired, but they can't get treatment. Or they're told you don't have any problems. You don't, or they might even flat out say you don't have apnea. Well, they do. And in my world, I'm looking for the 1, 2s, 3s, 4s because that's what's driving their clenching. That's driving their airway problem. And even if they don't have apnea and they have upper airway resistance, in other words, the airway's collapsing some, or they have a bad nose and they're mouth breathing a lot. Mouth breathing alone it messes with your carbon dioxide levels. And you lose too much carbon dioxide when you mouth breathe. And when that happens, the body can do several different things. If you don't if you don't have a high enough carbon dioxide level, the body wants to possibly shut down breathing. So there's different schools of thought with something called central apnea. Central apnea is where the brain doesn't tell you to breathe. So it's not obstructive, it's not the throat, it's the brain that's telling you not to breathe. And there's, it depends on who you talk to and what you look at, but there's the thought process that if you're mouth breathing too much, then the brain is going to tell you to not breathe, because if you don't breathe, then the carbon dioxide levels are going to come up. So is the computer making that happen? I mean, nobody really, really knows that, but it could be. So there is different types of breathing exercises you can do. It's called Buteyko breathing. You can look that up online. Buteyko, Buteyko. And there's a whole book about carbon dioxide. It's called the carbon dioxide syndrome. And there was this Dr. Buteyko. That's where the name comes from. And he was the one who figured out that through doing breathing exercises, you could change respiratory rate
Hmm.
and all these different things.
When you breathe out, when you breathe in through your nose and out through your mouth, you leave a little more room in your chest for more oxygen, your lungs, and also just your posture alone.
It uprights you.
Yes.
Studies have shown that nasal breathing can upright a person by, I believe it's 4.43 inches. That's incredible. That's being hunched over to being like this. And that's back problems. That's neck problems. That's
Everything.
all kinds of things. Yeah.
How many hours of sleep should people be getting a night?
Minimum of 7. The studies show now that if you don't get 7 hours of sleep, you are definitely more prone to having a chronic disease set in, Alzheimer's, different chronic stuff that happens to people. There are lots of different diseases out there. And lowering, we talked about apnea in particular, lowering your life expectancy by 10 years. So 7 hours minimum is good. And the average person now, they say the average person today is only getting 6.
Mm-hmm.
So that's not enough. And it's because of our work. It's because of the way our lives are nowadays. We're also busy. It's because of the technology we're looking at. We're not sleeping as long. Anxiety levels are high. It all plays into it. So 6 hours is not enough. Minimum of 7.
What advice would you give to parents who have a newborn or a child under 8 months that is woken up 2 and 3 times a night and then has to go to work the next day?
To the parent?
Yeah.
Well, that's a hard one
And it's
because
very
it
common.
is very common. And can you really do anything about it? Not really. Not unless you're not breastfeeding or you're pumping and the husband's willing to get up and feed the child so you can get a little more sleep. Unfortunately, that's a situation that's tough for every parent. The only saving graces you have is usually, you know, most people having children are under 40. And, as in everything else, we do better when we're younger too, but it's not healthy. It's not healthy. And I don't know any other way around it.
Right.
The child's got to eat. You got to take care of it. It is what it is. I don't
Mhm.
really have any great other than that maybe, the husband could join in a little more if she would pump and save some and bottle feed the baby some, but
Trade
with the
on and
breast
off with
milk.
feedings.
Mhm.
If
Or
even
train
the
the child to
father.
do both. Children do breastfed milk and
Formula.
formula.
Mhm.
There are children that do that. I know some who do.
Because I just want to make this comment.
Yeah.
Children are important and they are our future and all of
Right.
those things, but the people who take care of them have to be taken care of also. And so if you do need to supplement with formula so you can take care of this child, that's okay.
Well, I think so. I was not a breastfeeding mother. That just didn't work with my life, I have to say. And I don't know, my children are alive. And I know I will tell you this though. The one thing about breastfeeding that is a big deal that I would have tried harder for, in all seriousness, had I understood this back then, is jaw development. Jaw development, there is no way to get the best jaw development if you don't breastfeed your child. And they say about up to a year is the best for jaw development. Bottles do not develop the jaw in the same way. A child does not latch the same way. The swallow is different. And all of those things muscularly help to develop the jaw. And if you develop a reverse swallow from being bottle fed, a reverse swallow pulls the jaw backward every time you swallow. Well, we swallow 700 to 900 times a day is what they say. So if 700 to 900 times a day, your jaw is being pulled back for those swallows, it has a hard time growing forward because muscle will always win.
Mm.
Muscle will always win. So if you mouth breathe, that means your mouth is open, your tongue is down, not up against your palate when you're growing between 0 to 10 years old. When the head, 0 to 8, the head is like 90% grown by the time you're 8, I believe. And so those years are super important to the growth of the face, growth of the airway. And if the child is mouth breathing, it is awful for facial growth
Is
and
there
airway.
is there certain bottles, certain nipples, certain sippy cups, anything? No.
I do not. I would love, I'd love to be the inventor of
You
that.
could.
I
Why
would
not?
retire if I could figure that one out. I don't know. No, there is not one at this time. People are trying, but no, they have not figured that out. They have not completely figured that one out. Which seems like, with I don't know, all the technology stuff they know nowadays, it's like amazing what's going on, right? But they have not figured that one out, how to reproduce that. And
Well,
it's also
set these
how you
kids
hold
up
your
for
child.
success. Oh, go
Right.
ahead. What were
Well,
you
I was
saying?
gonna say it's how you hold your child too, and most people don't know this. And I only know it through the groups that I belong to with my TMJ facial pain stuff and growth of the face is that you do not want to hold the child sideways like everybody does. You want the child to sit next to you, sitting almost up at the breast, like
Mhm.
this, right? Because they can't breathe through their nose. If they're up against you sideways, the nose gets closed off. So they start to learn mouth breathing right there and then. But if the nose is out from the breast and they're sitting up drinking, the nose is not pressed against the breast and they can nasal breathe while they drink, while they breastfeed.
I'm just kind of on this little track right now about kids. What
Mhm.
about having them use straws instead of like the little sippy cups?
You know what? Honestly, there's no replacement for just getting them into a normal cup and drinking normally. Sippy cups can become a problem too. That sucking motion creates stuff with the muscles of the face. And the more you suck in your years of growth, the more damaging it is to the growth of your jaws laterally. And so you don't want them on a sippy cup forever. People keep those sippy cups around forever. And you want to honestly, you're better off transitioning from the bottle or breast right to a cup.
Well, and
Skip the sippy
honestly,
cup.
I have a sippy cup.
Oh, okay. All right.
I don't have a sippy cup. I joke about it. It's a
Yeah.
big water bottle.
Yeah.
It goes everywhere.
Yeah.
Everywhere I go, my water bottle goes. Is that different than a sippy cup? I mean, because I am.
Sucking still, yeah.
Is
but
that bad?
You doing it all day long?
I have my water bottle with me. Probably, I drink all day water. Yeah,
Mm.
I do. I think.
Mhm.
Well, I mean, we've been encouraged to drink water all
Right.
day.
Drink more water. Yeah.
But it is definitely out of a. Everyone I know has those.
Oh, yeah. I
I
can't
mean, the
say that I've
brands
thought of
change,
that one so
but it's
much,
still
but
a sippy cup.
it is. You're right. Haven't thought about that so much actually, but yeah, it's promoting muscular. People say to me all the time before I understood this stuff, "Why are my teeth getting more crooked?" I used to have, I had braces when I was a kid and my teeth were straight. Now they're not. They're getting more crooked as I'm aging. And they literally are because, excuse me, the muscular disharmony that never got corrected.
Mm-hmm.
If your teeth are crooked, you have a mouth breathing issue, whether you knew it or not as a kid, because that's how you develop narrow. The jaws are narrow and now the teeth are crooked because they can't all fit in the jaw. It is not that the jaw didn't grow. It's not that the teeth are too big for the jaw. It's that the jaw didn't grow big enough for the tongue and then therefore the teeth.
And I imagine that would cause significant speech issues for children.
Yeah. And tongue ties, that's a whole nother subject of tongue ties. becoming a little more talked about. I see a ton of posterior tongue ties in my practice with adults, and that can lead a posterior tongue tie can also make it harder to open your mouth. If the tongue is tied down into the throat more, you can't open as far. And it can and if you're tied down in the throat more, it will also make you more susceptible to sleep apnea because the tongue can't get up and out of your mouth. Now, that's not to say that everybody needs a tongue tie release, but a proper tongue tie release is done with what we call myofunctional therapy first. Myo means muscle. So there are people called myofunctional therapists that will help you to retrain the muscles of your face and the way you swallow and strengthen the tongue prior to a uh, frenum release. We call it the lingual frenum under the tongue, prior to cutting that literally and releasing it so the tongue can get up and out more. Unfortunately, tongue ties are really mostly identified when they're right to the tip or near the tip. The kid really can't stick the tongue out, or the adult can't really put it out. But there are so many posterior tongue ties that relate to and that can be the reason, that can be the final thing you got to do to help somebody get rid of their headache, because that's related to the fascia that's attached down the whole front of the tongue is attached to what we call the anterior band of fascia that runs down your whole front of your body, all the way down to the feet. So if you have a tongue tie, it can produce a um, compression or pulling forward of the fascia of your body. And the fascia is like the glue that holds everything together, around our muscles. It's like, it looks like saran wrap. If you see it, it's this clear, stretchy stuff, and it holds everything together. And it comes from the tongue all the way down the front of the chest, crosses over, and goes all the way down to the feet. And there's other fascia bands in our body too. But if the tongue is tied down over time, it can be part of the airway. You were talking about that earlier. The rolling of the shoulders forward, the body just kind of becoming like this because of a tongue tie can be a huge contributor to all of those different things happening. And for some people, when they get it released, their shoulders and everything just goes like this, and they'll say, "I can breathe," and they'll get kind of vertigo issues going on when they have it done because it's so releasing that the body's just overwhelmed by this opening up. And there are that is becoming a bigger deal in the dental world now, these tongue ties. And there are guys who specialize in that. But I have learned that not everybody needs a tongue tie release just because they have a posterior tongue tie. So it's not about that. I don't mean to produce that thought process that, oh, I have a tongue tie, I need to get it released. No, not necessarily. But some people do.
So what's your youngest patient that you've had?
Um, well, I can work with a child who's 3 or 4, but it's not orthopedically in the sense of putting an appliance in their mouth to open the airway. It's there are appliances I work with that are myofunctional appliances that when you put them in, it's actually the same appliance I used when I was having my problem. Because when you have it in, your lips have to grab around it, which forces you to nasal breathe without even having to think about it. Most people, even if you try to nasal breathe, when you go to focused activities, you may start mouth breathing again. So with the appliance in, when I was doing dentistry back when I was trying to help myself not mouth breathe anymore, I put this thing in so that I wouldn't mouth breathe whether I was thinking about it or not. Because with it in my mouth, my lips had to go around it, and I had to nasal breathe. So that uprighted me, right? So I work with similar appliances, but for younger kids. I can implement those. But there's a lot of parent involvement in that. Because you're talking about a child. I mean, we both have children, right? So and I know that,
They're gonna fight me on that
oh
every step of
yeah,
the way.
and it's a parent driven thing. If and even then you may fail with it. So what I've kind of found is the best, even though it's not best for the brain. We were talking about this brain development. The developmental curve on behavioral and all that. Actually, at one, or excuse me, yeah, I think it's at one, it's at its highest level. You have till a child's about 14 to 15 before it completely falls off, where you can have an effect on the behavior of that child. So, like the ODD, obstinate defiant disorder, the younger you catch these, the better, right, for the brain development. But I mean, like I have a young man who's 10, one of the first patients I treated with this, diagnosed with apnea, because I don't treat without that. I'm not just treating to treat, not expanding people just to expand them. I'm doing it because of a diagnosed apnea issue. And this child had that. His ADHD within 2 weeks, his teacher was already talking about what a different kid he was, and we hadn't hardly expanded him much. I think what really helped him was the vertical I gave him with the appliance. And yeah, it started to expand, but I think the vertical probably helped the child more instantaneously, kind of like an oral sleep device. And he's gotten better. We now just did a sleep study to see where we're at. Have we cured the apnea or not? Because I want to cure it in him. I want to develop this facial structure enough to develop that airway in the nasal cavity and the back of the throat that we get a negative reading on. We don't have apnea anymore. So got it back, and his sleep is way better. His fractionation of his sleep, he's staying in his REM and deep sleep better for the brain. However, he's still got some apnea. So we have more work to do. So we're going to go back and we're going to do a little more. And that's kind of how I work at it. And that protocol, there is no set protocol out there for this right now. So when parents come to me, we have this discussion. This is not mainstream. And is it helping? Yeah. Can I sit here and guarantee I'm going to get rid of their ADHD? No. But does it seem to help? Yeah, it does. So,
When I hear you talk, it reminds me of uh, you got like these wraparound services, but just in your brain. I mean, you're looking at stuff from all angles, not just if you're snoring or not.
oh yeah, there's so much more to it. Yeah,
There's
and
so
that's what
much
people
to
don't
it.
understand about what I do. It's not, here's your sleep appliance. Go home and quit snoring. And we test that too, by the way. There's protocol to that. You don't just get your snoring device and go home and advance it till you're out here with your jaw sticking out. Very few of my patients end up like that because you get them in the vertical is just as important as the movement forward of the jaw. And in many cases, vertical is more important than that. And so, and there's some technology I have that kind of helps me it's called a pharyngometer, and it helps me to test different positions with the jaw, because it's the lower jaw that's going to move, not the upper, and figure out probably where that patient's going to need to be when they get their appliance for them to have their best airway. But that position might not be the starting position because their musculature and their joints may or may not handle that position, meaning maybe it's 10 millimeters open. Well, if you have some TMJ symptoms, I don't want to start you at 10 millimeters open. That can hurt your joint. And that's where it's really advantageous for me to have both degrees, is that I understand the TMJ side of it and what effect an appliance can have on that. And it can have a negative effect on that. And if you don't know what to do with it, then as a practitioner, you're putting yourself in a position that's not good. You better know how to handle that, because if it comes up, and it does come up from time to time, even in the ones who have no pain, every once in a while, it doesn't happen very often, but the non-pain sleep patients, when I put an appliance in their mouth, very often we don't have any problems, but once in a while we do. And we have to back off or, lower things, or we have to know what to do. Sometimes I need to inject the joint. Sometimes I need to do some laser therapy. There's different things that we do in the office to help those things. But um, yeah, so there's a lot of different facets to it.
Can you essentially give yourself sleep apnea? I mean, because of being overweight, is it something that you could give yourself?
hmm So there's a really good book out there called Breathe. And I'm not good at remembering authors' names, but it's just called Breathe. And it's like a gold yellow book. And it says Breathe. And this guy did a test. He literally plugged his nose for weeks to see what would happen. He developed sleep apnea within those 2 weeks, and he felt awful, and he started to feel sick. I always tell people, you know, don't you think you'd be sick if the cold, dirty air was slamming the back of your throat all day or all night because you're mouth breathing? Why do you think your tonsils are big, but you're not sick? A lot of adults have big tonsils. Children have big tonsils, but they're not sick officially. They're just big. So the tonsils are a lymphatic tissue, meaning lymphatic tissue gathers bacteria. It's a defense tissue within the body. And our adenoids, which are up above in the back of the throat at the bottom of the base of the nasal cavity, back of the nasal cavity, are also lymphatic tissue. And when a child has big, tonsils and respiratory issues all the time, they're a mouth breather. There's no question. And an adult, same way. Big tonsils, they're a mouth breather. Sleep study, what do they got going on? What's their airway problem, right? So we can get that mouth closed and get them nasal breathing. Sometimes that requires surgery, but tonsillectomies for children in studies, what they've shown is that is only 25% effective to taking apnea away completely. And the problem is they have their tonsils out and then nobody checks them with a sleep study 6 months, 8 months, 10 months later. And the child may still have sleep apnea. So tonsils are not everything when it comes to treating sleep apnea in children. It's the first thing they want to do when a child has sleep apnea, tonsillectomy, because usually they're big, or adenoid and tonsillectomy. And if the child seems to be sleeping better, yeah, they leave it alone. But they may still have apnea and it's not cured. So it has to be looked at fully down the road once those things are done, because statistically it will not cure it more than 25% of the time, that one thing.
So we could go and check on our children and see if their mouth is open when they're sleeping.
hmm And it could be just open a little bit. It doesn't have to be hanging wide open. Another thing kids who have airway problems do is they sleep with their head extended. They like their head extended. That's because that's CPR. Head tilt is CPR. So you can breathe
I'm
better.
actually seeing some things in my mind right now that
And grinding,
that's not something
huge
that
red flag. Children or adult, doesn't matter which. If you're grinding and you don't have a chronic pain issue, you probably have an airway problem.
if you aren't born with an underbite, can sleep apnea cause one? Is it the underbite that's a concern? And then you said the crooked teeth.
The underbite is developed from the airway problem and the muscular disharmony that's created. An underbite is created by that. Genetics, when you have an airway problem, you don't reach your genetic potential. Your face does not grow properly. You don't reach your genetic
What about an
potential.
overbite?
Same thing. Doesn't matter. Overbite, underbite, the class 3 bulldog look, maxilla didn't develop properly forward. It's more often not that the mandible or the lower jaw developed too far forward. It's that the maxilla or the upper jaw did not grow forward properly due to muscular disharmony, most likely created by mouth breathing.
Wow, it's
And there's
fascinating.
other things too. When you're born, you can have sutural lockups of the skull. We got all these sutures, where our bones come together, and that can get screwed up during birth. And colicky children, you need to find somebody who can do a cranial adjustment, because that child may not have colic. They may just have a cranial lockup from birth, and they actually don't feel good. They hurt. They're crying because they don't feel good. And that can, cranial lockups can affect the way the nerves come out of the skull and then travel down to different things like um, um, IBS, irritable bowel syndrome. Lots of irritable bowel syndrome people actually have airway problems.
How come this information isn't in pediatrician's office?
It's not mainstream. It's not mainstream. This information lives within the gray area of dental world in a lot of ways. It's a very gray area. Craniofacial development, orthodontists are taught craniofacial development, but they don't go into the this kind of stuff that I'm talking about, how nerves can be affected from muscle tightness, even just from clenching too much. If you have a nerve entrapment coming through the muscle, one of the branches of the trigeminal nerve from a tight muscle can make that nerve start firing wonky, and then you get these shooting pains. Nobody teaches that. They don't teach much about it in dental school, and they don't teach much. It's just not mainstream. You have to go find these groups, find an interest in it, and go find it and learn about it. And there are groups like that. There's the oral facial pain group, craniofacial pain. I belong to the American Academy of Craniofacial Pain. American Board of Craniofacial Pain is my board certification. The American Board of Dental Sleep Medicine. That's the board that goes hand in hand with the AASM, which is the American Board of Sleep Medicine, which is the MD's world. Those two go together. And then I'm also belong to the American Academy of Craniofacial Dental Sleep Medicine, which is more the tie-in between the craniofacial pain and the sleep issues. And so everything I look at in any patient that comes in is always about airway first. Where's the airway problem? How bad is it? What do we need to do to help it? Sometimes it's just good nasal protocol will help a lot.
And that's what I want to talk about is the nasal protocol, because what if there is no diagnosis, but you do have a child who's sleeping, like you said, with their head back, they're snoring, their jaw is they have an overbite, underbite, or adults, it seems like they might start snoring. No one really thinks about sleep apnea, but that's just normal when you turn 40.
Right.
Uh,
Excuses.
what can people do on a day-to-day basis as far as keeping themselves healthy? The
Get a sleep
nasal
study.
protocol. But what if you go to sleep study and they say you're not a 1, 2, or 3, or 4, and so they can't go see someone like you?
They can come see me anytime.
Okay.
I don't need you do not need a referral to come see me.
Okay.
You can call my office and just, hey, I think I have an airway problem. I'm clenching, I'm grinding, I have headaches. I don't know what's wrong with me, but I heard you and some of the things resonated with me and I want to come in. Come on in.
Okay, so just because I want to reinforce that you're located at,
I'm located at the TMJ and Sleep Therapy Center in Montana, and we are at 114 13th Street South, right here in Great Falls.
would you be comfortable giving out your phone number
Oh,
for
yeah.
appointments?
Yeah. It's 406-952-0154.
I, cool. Because this resonates in so many different areas. I don't know that people think of that though, first thing.
Like I said earlier, most people have seen 2, 3, 4, and dentists are included in that group of docs. The dentists they don't know all this stuff, or they don't know enough to know to refer. And so even within my own, you know, group of docs, they don't always know to refer. And that's unfortunate, but it's just the way things are. We pursue what we pursue to learn. We learn a certain amount, and and we stop, you know. And so, yeah, ear symptoms. My ENTs, they know about TMJ. I've talked with them more often than not. They're a big referral source. I'll get a lot of ear stuff from the EMTs. I get a few neurology referrals. My biggest referral base is NPs, nurse practitioners, and PAs by far.
For parents who have children that always have ear infections, is that related in some way?
Probably.
Instead of that, what they
Like,
do
what's
is
their
put tubes in their ears and
throat
have
look like?
surgery.
Yeah, what's their throat look like? And the hard thing is that really young group, right? But even babies can have their tonsils out, but tonsillectomies I don't take them lightly. I've learned enough to know that tonsillectomy is a big deal. It can be a life-threatening surgery. You don't want it done if you don't have to. And I've got some new things I'm working on with that. That are along the lines of, I guess all I'm going to really say about it is sterilizing the tonsils, and then they will shrink on their own. There's some new stuff we're looking at with that, which I'm not going to really talk about on this show, but it's just in the form of helping sterilize them, is how I'm going to put it.
It's
and
it's another option
they'll
that you're
shrink.
working
They
on.
will shrink without surgery. It's pretty cool.
Exciting.
Yeah, I'm very excited about this in particular for my kids and my adults because having a tonsillectomy as an adult is horrible. Everybody who's ever done it, it's horrible. That's what they say. So nobody wants that. And you don't want it for your kid either because it's can be a life-threatening surgery. It happens. Children, I mean, any surgery has its risks, right? But
Mhm.
tonsillectomies are known for it can be kind of a hard deal. It's hard afterwards. You get ear symptoms. It hurts. Not good. My daughter had to have them out.
Mhm.
And turns out my daughter has an airway problem and she had a deviated septum and a lot of different things that I wish I had known all this when my
Mhm.
kids were little. Like I said, there was different things about each one of my children. My oldest boy's lower jaw wasn't developing properly. Had a huge overbite, huge. And then took him to the orthodontist. They put in this appliance that brings the jaw forward. Guess what? Oral sleep appliance, sleep apnea appliance. He grew 6 inches like that because growth happens in children in sleep. Growth hormone is released during sleep. And a lot of children are either undersized, don't eat well, really tiny, skinny, and not growing properly, or they can be very overweight children too. Remember, we talked about hormones and stuff with apnea in kids. So that you can see both presentations. But if they're snoring, they need a sleep study. And there's behavioral stuff, especially that child needs a sleep study.
Hmm.
So
That's interesting, and I think a lot that's gonna resonate with a lot of parents.
I know it will. I get the kids I do see, parents are like, I don't know what to do. It was a friend of mine recently, like I said, had been to neurologists and everybody. And I just had to observe this child at an event, and his mouth was hanging the whole time, just hanging open. And I knew that this child had some behavioral issues. I didn't know to what extent. I just had heard. And I finally went up to her and I just said to her, I said, "Does he sleep well? What is he got the ADHD thing going?" She looked at me and she just said, you have no idea."
Mhm. Well, and I don't know if you agree with this or not, but meth use causes just horrible teeth. But I recently read an article that it's not so much the meth, it's that when you use meth, you mouth breathe, and then it dries out everything in your mouth, and that's why it destroys your teeth.
Well, it's that and the acid. It
And
has a huge
the chemicals.
chemical acid in it. And I don't know which it is, but I lean more towards the acidic of it. But you combine that with mouth breathing, your mouth is more acidic when you mouth breathe. That's why mouth breathing parents or adults or excuse me, adults or children tend to get more cavities because their mouth is more acidic. They don't have as much saliva. Saliva is very basic in nature, um, acidity wise, very, very neutral. And so you need saliva to keep your mouth in the neutral state of acidity. If you get an acidic mouth, you definitely will get more cavities. And a lot of the meds people are taking nowadays too dry out the mouth.
Yeah.
And you'll see that too. So, but yeah.
So for good sleep I heard you say sleep hygiene. How
Mhm.
would you describe good sleep hygiene?
Good sleep hygiene would be definitely not eating after 7 o'clock at night for sure. Not eating fatty foods before bed. That will disrupt your sleep. High fatty foods. Alcohol before bed and no blue lights after 6. I personally think 6. Cell phones should go in a basket and we should leave them alone. Computers, even watching TV right up till bed isn't really a good idea. Some people sleep so poorly they have to watch TV to fall asleep because they can't fall asleep any other way. And I know one thing I was at one educational event I was at one time, this sort of resonated is why do you think you don't want to fall asleep? If your brain knows when you fall asleep you suffocate, do you think your brain wants you to go to sleep? That was an interesting idea to me that maybe that is the brain's just protecting you from what's going to happen when you do go to sleep, which is awful. Is that part of the insomnia, thing, the behavioral aspect of the brain doing that? I don't know.
Um, Blue lights are something that can be avoided Do red lights encourage sleep?
You know, I don't know. I don't know. You asked me earlier if there's something you don't want me to ask. I don't know, but I'm gonna look that up because I don't know that. But blue lights I know do, very definitely. And screens and screen time, all of that's bad. So,
And keeping a routine. So if you normally go to bed at 10 and maybe it's 11 o'clock, gets to be 11 or 12, and maybe even you can sleep in the next day a little longer, would you recommend just staying on the same schedule or just being able to treat yourself and then sleep in sometimes?
so we had briefly touched on circadian rhythms earlier, and circadian rhythms are controlled by light has a huge impact on when we feel like going to sleep and when we feel like waking up. So part of good hygiene is if you don't go to sleep till midnight and then you sleep in till I don't know if you can because of work or whatever, was shift work is a whole nother
Mhm.
a problem for sleep. That's a horrible thing for sleep. But if you're able to, sleep in till you go to bed at midnight and you wake up at 7, well, you're still not getting enough sleep. And but the way to work it back is if you can, wake up earlier, right when the sun comes up for the light, and you will naturally over time slowly be able to back it up and go to bed earlier. But you got to stop all the video games, whatever it is you get to doing and with these habits,
I
that
almost want to
helps too.
say it's like fake light.
Hmm.
The screens
Yeah,
are fake light.
they
They're
are.
not real.
They are.
Is the light through windows equivalent to maybe standing out in your yard and
Yeah,
absorbing the light?
yeah.
Or is there a barrier there with sunglasses not
Well,
getting into your
there's the screens you can get. There are, blue light protector screens. You can put
Mhm.
them on your computer. You can put them in your glasses. You can put them on your phone. All of that can be done. And those are the kinds of things that a person needs to pay attention to. One of them. But also the other stuff, like people say, "Well, I don't go to bed because I video game." I'm a gamer. I guess they call themselves nowadays, right? But if you're gaming, you're in front of the screen and you're keeping your brain busy. Well, if you really are serious about changing a habit, you got to make a change. It's no different than wanting to lose weight. You got to change something or it's not going to change. And however, I also tell people if your sleep is so poor and that's contributing to your weight gain, you really are hungry. Your hormones are screwed up. The hormone that tells you when you're full is wrong. The hormone that tells you when you're hungry is wrong. So you're hungry all the time and you don't feel full when you should feel full. So they get messed up
and
from sleep apnea
okay, so
as a contributor at least. Sure.
because your body is creating hormones when you're not sleeping, telling you that you need more of food and that
Right.
you need more energy or
Mhm.
substance, and during the day you're eating, and that's just a vicious
A
cycle.
vicious cycle, exactly. So if you get the sleep apnea treated, whether it's a CPAP, great. If you can do it, that'll definitely treat it. Or an oral sleep device in combination with either one of those in combination with good sleep hygiene, you may actually then start being able to get control of your weight gain. And some of these drugs are good because if you have insulin resistance, that's part of the issue with the hormones, right? So maybe you do need a little help with that. I'm not poo-pooing. Some of those drugs help people, but they're borderline diabetics is what if you have insulin resistance issues, you could be pre-diabetic and not know it.
Well, like 60% of our population is.
Yeah, we are so as a country, I think, oh gosh, what is the statistics now on obesity? It's horrible. And you don't have to look too far to see it. And it's a combination of things, when processed foods came into our world in I think it was the 70s, early 80s is when processed foods came into our world and fast foods and all that. It just has changed dynamics. And not only that, but life has gotten easier. You know what I mean? We didn't drive everywhere. There's so many factors that play into that and the video games and the entertainment in front of our eyes at all times. We don't have to go very far to go do something. we're looking, craving for entertainment all the time right in front of us. And
We
but
have too many options.
processed foods was a biggie.
Mhm.
So what we put in our mouths does make a difference too. But all these other things are playing into it too. So you have to, as an individual trying to get healthy, you need to evaluate what are those things that I could maybe I need to try. Yeah, maybe I need to get a sleep study. Let's get that fixed. Then maybe I'll feel better. Maybe I need a little help starting my weight loss journey with a drug from a physician helping me. And then as I lose weight, and get better sleep, now these things starting to get in order, and eating better and exercise but it's a lot for somebody to start that journey, because I think it's probably quite overwhelming to think
Yeah.
about.
Whether you're into getting fit or staying fit or just having fun with the family, join the Peak Health and Wellness Center today. With 2 great locations in Great Falls, they're here to serve you. If you like weightlifting, functional fitness, or enjoy a wide selection of cardio equipment, the Peak has everything you need. They also offer classes for all ages and fitness levels. The Peak even has a daycare for those busy parents out there. Go check out the Peak today. The Double Barrel Cafe is all about you, the amazing people of Cascade County. With every purchase you make, they give back to our community. Every bite and sip fuels their mission. Let's make a positive change, 1 cup and 1 bite at a time, because the Double Barrel is not just a cafe, they're building a better community. If you haven't noticed lately, Cascade County is booming, and the choice for all your construction needs is Builders First Source. They even have an automated home builders solution for all of your construction needs. Go to 826 Northwest Bypass in Great Falls and check them out today. Are you looking to replace those floors in your home? Or maybe you're doing new construction? The place I trust is Contract Flooring Carpet One. This is a locally owned and operated business here in Great Falls, and they are committed to serving you and giving you the very best prices and the very best product and service. Go see Contract Flooring Carpet One today. You'll be floored. When deciding who I would trust for the technology component of this podcast, the choice was simple: Information Systems of Montana. Whether purchasing products for business or when I had them build me a new MacBook to catch child predators, they delivered, creating a solution for my exact needs. Contact Information Systems of Montana today. Everybody needs a good insurance plan. Whether it's for home or auto insurance, check out Heinbaugh Agency. Eric Heinbaugh is a local agent focused only on customer service, not sales. If you're passionate about firearms and the Second Amendment like I am, one of the best places in all of Montana to go is Mitchell Supply. Jim and Tammy Mitchell have been running this gun store for decades. They're major supporters of the Second Amendment, and they're major supporters of our community. And obviously, they're supporters of this podcast. For all your firearms needs, go check out Mitchell Supply today.
Do you think that there's a certain age where sleep apnea becomes more of a expectant?
Well, I think as a society, we don't think of sleep apnea for the young. We think of it as more for the middle-aged, older person, right? And it is a reality. It definitely happens more to 45-year-olds on and up, women in particular, with the hormone changes. Um, we tend to think that way, but quite honestly, children have it too. So it's really not fair to say at what age, because it's everywhere.
Well,
Very common.
well, I'm asking that because it seems that people get to a certain age and oh, I just can't do it. My joints are sore and I can't do these things anymore. And I'm just going to stay at home. But that could be because of sleeping issues.
And there is a real thing. The older we get, we do sleep less.
Mm.
We do sleep less. So the sleep you get needs to be good sleep
Why
to
do you
stay
sleep
healthy.
less?
It's just a change in our physiology. I don't know the actual chemistry behind that. I can't tell you that. But I do know that when you look at sleep patterns, so a baby sleeps all the time because of the growth happening, right? If you don't sleep, you don't grow, right? So the child that's not growing properly probably isn't getting good sleep. Then you get to the teenage years with hormones changing, this and that. They sleep a lot. There is a reality to that. You asked me about that. So there's a change from sleeping. Babies, oh gosh, a baby sleeps. A baby isn't awake, in the real first few months more than, what, an hour or two at a time.
They sleep 16 hours a day.
Yeah, it's a lot of sleep. And they're supposed to because they're growing.
Mhm.
But then you move into toddler and it starts moving down from there. But by the time you reach 18, you really should not be sleeping more. If you feel you need 10 hours of sleep and you're an 18-year-old, 20-year-old, 30-year-old, 50-year-old, doesn't matter. If you feel you really need 10 hours of sleep, then you've got a quality sleep problem, which is probably an airway issue.
Hmm.
Nobody needs 10 hours of sleep. There's something wrong if you need 10 hours of sleep.
So the first step is would you need a referral to get the sleep study from a
You do.
nurse practitioner or doctor?
Yep. You just tell them, whether you snore or not, excessive daytime sleepiness,
Okay.
hypertension, high blood pressure, diabetes, heart problems, um, just I'm tired and I snore. We'll get you a sleep study. Um, Witnessed apneas by either you wake up choking, you're aware you wake up choking and you're tired. Your bed partner knows you choke. Your bed partner witnesses you not.
Choking or coughing?
Yeah, choking, coughing, whatever you want to call it. It could be any version of that, right? But waking up with it, most likely there's something going on with your airway. If that's happening regularly every night, then definitely it's worth exploring.
Waking up with a headache?
Yep, waking up with a headache, morning headaches. Those are the biggies. Yeah. And snoring is just not snoring. People really poo-poo that too much. And like I said, a lot of my pain patients come in, we start talking about this stuff and I'll say that and they go, "Well, yeah, I snore a little. It's not much though." And then I'm like, "Well, okay. So here's what you don't know about yourself. That you already have an airway problem." And you hear me say that. I don't say apnea all the time. I say airway issues, airway problem, because there's a lot of different forms and levels of airway problems. Apnea just happens to be the worst. But everything down below it is just as damaging, can be just as
Mhm.
bad for the pain patient, for, you know, autoimmune diseases come from poor sleep a lot of times, gets affected, arthritis. You're more inflamed when you don't sleep well. You're more inflamed. So you don't feel better. You got to clear out all that toxin from every day.
Is there a position, like a sleep position that's better than others?
Your side.
Sleep on your side? Is there left or right side?
Not necessarily. No,
What about the
just
people
side.
who fall asleep in their chairs, sleep there all night,
Well,
sitting up all night?
why do they do that?
I mean, they're watching TV and they fall asleep, I assume. Or
So,
their wives kicked them out of the room
well, because they're snoring.
because they're snoring too much.
Right. So, yeah, it's just, I mean, it's not good. It's like maybe you need to explore that. Why do you like to sleep in a chair? Is it because when you sleep on your back, you're suffocating and you don't know it? I mean, could be that simple. And you can't fall asleep because you have insomnia, because when you do go to sleep, you have apnea.
You have to
You know.
forgive me, but I don't even know what a sleep apnea machine looks like. I don't even know
Oh,
what that
a
entails.
CPAP, and there's different types of CPAPs, but there's a mask. There's different types of masks. So you can have a full face mask. Looks like have you ever watched a show where they put on an oxygen mask on
Yes.
somebody? Okay, so there's that version. It goes over the nose and the mouth like that. Then there's version just goes over the nose, doesn't do anything with the mouth. Then there's different nose versions too. There's things called nasal pillows that just sit right at the nostrils and push. And all of those things, different masks, are hooked up to a hose, and the machine is sitting by the bed. And the machines have come a long way. They're a lot quieter. They're better. I mean, CPAPs have come a long way. They're way better than they used to be. And I'll tell you something, if you can wear a CPAP and it changes your life, you will never get rid of that CPAP. And that's a good thing, because if you're that tired and all of a sudden you have a new life because you got energy and you feel good. And that's what I meant earlier. I don't poo-poo CPAPs at all. I think they're a great thing for people. They treat it well. They treat it the best. But not everybody can wear them. So then we have to look at other things. And there's other things out there too. Now there's something called Inspire that's just come out. A lot of people are asking me about that. That's like it's an implanted wire. My understanding of it is they implant a electrode into the throat area that stimulates the muscles of the throat when it goes into a collapse. So it's like kind of like a pacemaker. I believe it's implanted. And I think you turn it on when you go to bed.
Wow.
But it works for some people. Some people get a little bit of interruption in their sleep too much because it wakes you up. I mean, it's, you know, causing a reaction in the throat to happen. So I don't know enough about that to really talk about it too much, but I know it's becoming a more talked about thing, and I don't know what the parameters are around how you get that. I I I suspect insurance doesn't go straight to that. Insurance has all the rules. You can do this, and then you can do that, and then you can have this if you fail at this and that. I suspect there's something about that that's like that, but I don't really know. So,
Does insurance cover sleep studies
mhm,
and your services?
as long as you meet medical necessity. So for my services, you have to have a sleep study that shows you have apnea. And then we will definitely work with your insurance. And different insurances cover it differently. So sometimes there's out of pocket.
Hmm.
Um, but
But
we,
it's your life and health.
well, exactly. People pay a lot for a little diamond on their
That's
hand.
right.
They pay a lot for a fancy car or even not so fancy a car. It's,
For the
hard to get a car.
computers,
Yeah, it
the
can be.
things we're talking about that are so bad for us, we pay a lot of money
Exactly.
for those things.
It's where you put your value. Yeah,
Mm-hmm.
for sure. But yeah, we do work. We bill insurance. Yeah. So I try one of my latest mantras, or I don't know what you want to call it. I've really adopted. I want to find a way to treat that everybody gets treatment if I can help it. I mean, I can't pay you to come in and get an appliance, but if you have insurance and we can't work out something else, I'm trying to make it happen for people. I really am. I mean, I can't do that. If every patient did that with me now, I probably wouldn't be in business anymore, but I'm trying
Well, this
to
has
make it
changed your
happen.
life. You
Oh,
were in
yeah.
pain. You had no idea why you tried all these things. You tried this thing and it was magical. And I'm
Yeah.
sure you get the reinforcement from your patients that yes,
Oh,
this works. People need to know about this.
oh yeah. Oh, yeah. It's why I'm so passionate about it, I think, because, I'd done dentistry for years and years, and dentistry has its rewards too from the standpoint of being a provider, certainly. Um, but I find this to be it's I get to help people that can't get help anywhere else by what I do.
Mm-hmm.
And that's big. That's self-rewarding to me to help a person at that level when meds haven't even worked. And we give them a appliance that's proper for what they need and
Mm-hmm.
the headache's gone. And they're crying in my chair a week later. They don't understand how they don't have a headache anymore. That's
Very rewarding. That's cool.
yeah.
Good for you.
So I love what I do.
Yeah. Is there anything else that you'd like people to know that we haven't talked about?
Um, Not really. I think we've really covered the gamut. We've talked about the different types of pain patients. Ear ringing, I think I mentioned that. Ear ringing can be from clenching.
What
Not
about
always.
what about vertigo?
Oh yeah, vertigo can be in there too. Dizziness can come.
Because your nose has it's fluid, so
Well, it's two things actually. Yeah, the nose can be part of that, but the ears. So anatomically, the TMJ or the the temporomandibular joint, the TMJ, is located right in front of the ear canal. The anterior wall of the auditory canal is the posterior wall of the TMJ. And there's a little groove in there at the top of the joint that goes back. There's a ligament attachment. They call it a remnant that comes from the ligament that attaches to the disc that's supposed to be between the bones in the temporomandibular joint. That ligament gets broken down from clenching and grinding for years, and the disc starts moving around. And that little ligament remnant passes through that little canal back into the middle ear. And it actually attaches to one of the 3 bones in the middle ear. I believe it's the malleus bone. And when the ligament gets so loose that the disc is falling off and on, now that's tugging because it's not in the right place anymore. And that tugging can produce different ear symptoms. The clenching alone can interfere with the blood vessel and nerves that also pass from the back of the joint into the ear and cause ringing type symptoms, congestion, ear itchiness, hearing yourself talk. It can mess with the eustachian tubes, the clenching. There's ear stuff. In fact, for whatever reason, it seems like in the last few months I've seen more ear type patients. And just through the appliance that we use, like I said, some of my pain patients, even ear patients, need a daytime appliance component for a while till things heal enough that we take that away. And we always want to take that away if we can. I don't want anyone to be married to an appliance all day.
Mm-hmm.
But the nighttime is important because to control where the damage happened in the first place, which was that nighttime heavy clenching that we talked about. But that is an airway problem. It's causing all that, see? So you really have to look at the origin of all these problems is the unidentified airway problem, whether it's apnea, upper airway resistance issues, nasal issues. Got to figure that out because that's the crux of it all that brings all these other symptoms on. So,
And aside from being diagnosed with any of these issues, during the day, if you could consciously through the day nose breathe,
yes.
when you have your mouth closed, where should your tongue be? How should your teeth be open? Can you walk me through that?
We call it tongue on the spot, right behind, not on the front teeth, but right on the tissue, right behind the front teeth on the top.
Really?
That's where the tongue should be.
On the top of
Up.
your mouth.
Up.
I don't even know if
Close.
I can do that.
Well, I haven't looked in your mouth.
All day?
Who knows? Yeah,
Like-
all day. And the nasal breathing, we get more nitric oxide when we nasal breathe. It's given, it's added to the air as it passes by our sinuses. The sinus cavity has nitric oxide in it. Nitric oxide is a natural vasodilator, which means you will oxygenate better if you're breathing through your nose. You'll be calmer. The more you mouth breathe, the more agitated you become because those carbon dioxide levels, when they're out of whack, actually agitates the levels of carbon dioxide being improper agitates your nervous system. And it can agitate, like a form of exercise-induced asthma is because of the mouth breathing and the carbon dioxide levels being improper. You can read about that all in that carbon dioxide syndrome book that I mentioned. There's another one called The Oxygen Advantage. Those 2 books hand in hand are great books that talk about proper breathing, physiology, if you like that sort of thing, and meaning the biology behind why our bodies do what they do in response to low carbon dioxide, high carbon dioxide, respiratory rate. It just talks about breathing and the physiology behind it. And then the Oxygen Advantage book talks about how it actually lays out how you can change your breathing patterns. And if you want to go further, you can go to the Buteyko stuff that we talked about. And there's actually Buteyko coaches online you can sign up with for a 6-week, 8-week program. And You can get a coach to help you.
And that's Buteko.
Buteyko,
Oh, okay.
I believe, Buteyko. And he's the guy in that carbon dioxide syndrome book.
This
It's
should
really fascinating
well,
stuff.
and this should just be a part of if you exercise and you eat well, you should be breathing well.
Totally.
It's just they all fit.
Mhm.
But this has not been taught.
No, the more you mouth breathe, the poorer your oxygen exchange is between the bloodstream and the cells. Because carbon dioxide is actually what drives your respiratory rate until your oxygen levels get so low. And I believe oxygen levels have to get down to like 35% before oxygen is what actually is driving your respiratory rate, if I remember correctly from that book. That's fascinating, isn't it?
Yes.
Because we get wigged out when we drop below 90.
80.
Yeah, well, 90, 80,
Yeah,
80
90 is the ideal, but
right.
to go down to 30,
You can't hold your breath long enough and be conscious to even hardly most people can't hold it long enough to get below 90, if that tells you something, and then you pass out. So
this is 30%. This is just fun.
yeah, so that's great. I love that stuff. I've read and reread that book a lot just to figure out what that physiology is and why just a high respiratory rate and not mouth breathing can be damaging.
I think all of us have that though. I think we're living in a fight or flight world, and that that our nervous system is a little bit on overdrive. And then maybe if you could
Nowadays.
work in this breathing, that would help that.
Oh yeah, you can calm your proper breathing. You can actually learn techniques to calm yourself, calm your nerves by nasal breathing. Nasal breathing goes into the parasympathetic nervous system, which is our calm nervous system versus fight or flight. When you're mouth breathing, you are sympathetic. You are running from the bear all night. You're running from the bear all night when you have apnea because your cortisol levels are high in fight or flight.
When you are out in public and you see people, are you just like, you need a sleep study?
I
I
can't
mean,
help it. I look
how do you
around.
stop yourself?
Oh my
Because if you
gosh,
see
yeah.
all the people with that, I mean,
That's a lot.
how do you not say something?
Well, and then you look at facial profiles. Like I told you, there's a lot of facial development stuff. I can look at a face and go, "Oh boy." Even if they have their mouth closed, that's a face of a mouth breathing child. That's why that face looks the way it does. You can just see it when you understand how the face doesn't grow properly. A long and narrow face is a mouth breather, for sure. Long and narrow faces.
A really funny story. He probably won't appreciate it very much, but my old partner at work, his name is Josh. I always called him a mouth breather just to insult him.
Oh dear, yeah. Well, you see that in movies now even. They say that.
They
You're a
do.
mouth breather. Oh yeah. It's considered kind of a
But I don't think people
bad
really
thing.
realize how bad it is for you.
It really is bad. It is. It's not funny. It really is bad.
So you
in
can
many
put a
ways.
piece of tape on your mouth.
But only if your nose will be open when you're sleeping, especially when you're sleeping. If you don't have an open nose, you probably won't tolerate tape on your mouth. Meaning, go get some breathe rights. Try that. But one other thing about breathe rights that's wrong, in my opinion, when you look at the box on a breathe right, they show the strip way up in the middle of the nose. It needs to come down and get over the nostrils and pop them out. So I show my patients this. If this is what you want to use as an adjunct at night to help us get your nasal valve compromise under control, and you don't want to wear something in your nose because there's internal dilators. There's lots of different versions of internal dilators. You can look those up online. But external dilation is mostly through a breathe right form of a product.
And you're saying just move it down lower. And
Move it down lower so it gets your nostrils when you bring it down. And also what really helps is taking a little rubbing alcohol. If you're, man or woman, you got oil on your face, makeup, whatever, get your makeup off. Oil, take that and rub your nose, that lower part of the nose where you're going to put it, and let it dry a minute, and then put that on. It will stay on all night. I guarantee you it won't come off. In fact, when you wake up in the morning, you have to be very careful when you take it off, or you can pull skin off with those things. And I get patients who are like, "Oh, I can't do it. I can't do it." Eh, honestly, I know what it feels like. It can be really hard to get them off, but get in the shower with some warm water, just work at it gently. You can get them off, but they're fantastic. Fantastic. I
I
love
don't
'em.
think we finished talking about the nasal. I'm so sorry. I keep is it
No, it's okay.
what is it called when you clear out your nose with that
Oh,
machine?
I think lavage or neti
Lavage.
potting, neti
Is
pot.
that something that people could do before bed?
Mhm. Oh, yeah. If you have real allergy, a lot of problems with your nose, but you might have a deviated septum too that's also blocking things, but, and that might be a reason that a neti pot doesn't feel very good to you because you got a real blockage, and so it's really blocking up. When you blow that in there, it's really, like, burning and hurting, and maybe because it can't really get out the other side because you have a deviated septum or something, but if you can do it, it'll really clear stuff out, clear the junk out, rinse the tissues,
Mhm.
get rid of bacteria, um
What about nose spray medication?
nasal spray, I've gone up and down with this. When I first started, I wasn't a huge proponent of the decongestants. However, having said that, I love a good saline. There's a product out there called Clear. It's spelled with an X and then Lear, and it's pronounced clear. It's saline and xylitol. Xylitol is a product you hear about, and as a sweetener, right? Like in
Mhm, like a fake sugar.
yeah, but xylitol has antibacterial, antiviral properties, and so they added into that with the saline, and that was one of the things I did too when I started treating myself finally when I had all these issues. And I used to get bronchitis, oh, pretty much like clockwork every January, February. I'd be coughing all day under my mask, trying to work, blah blah blah, because I'm a mouth breather. I didn't know I was at the time, right? And, and I was bronchitis all the time as a kid too. So when I look back at things,
Mhm.
I see that I was an airway kid, and I'm definitely on the more ADHD spectrum for sure. School was really hard for me. I honestly, it was only my personality type, whatever given to me as a person that got me through school. School is tough for me. I have to read things 2 or 3 times. They say that ADHD people have to read things 2 or 3 times because they don't see every word. That's why they have to read and reread to get it. But my personality type is a very driven.
Well, you're certified on 3 different
Well,
boards.
yeah,
I would
obviously I'm
say
not
that
stupid, right? But it was hard
your
for
will
me. I
pushed you
yeah,
through
my
it.
yeah, my personal will, what personality, whatever you want to call that, to learn and whatever just was there, and so I was able to overcome that and do well enough to become what I became, a dentist, and then this, and whatever. But um, I still have to read things a few times, and I do recognize that when I'm mouth breathing too much, I'm really nervous. I see that in myself now. I'm much more nervous when I'm if I get to talking, and that's hard because when you do what I do, I talk a lot all day. So I can get kind of hyped up during the day from talking so much because there is a method to learn to talk and stop and nasal breathe. I have not mastered that. So it is what it is. But my nose can get really stuffy during the day too
Because
from
your mouth
talking too
'cause
much.
mhm.
And that's the carbon dioxide thing. Your body's trying to shut down something so you don't lose so much carbon dioxide. But guess what? You keep talking and mouth breathing, you keep losing it. So the brain thinks, well, I could shut this down, meaning my nose, and maybe I wouldn't lose so much carbon dioxide, but it doesn't help. Just makes you mouth breathe more.
Mhm.
So there's other techniques for opening up the nose. There's some of the Buteco myofunctional stuff. There's exercises called the nose clearing exercise where you breathe out and then you squeeze your nose and you tilt your head side to side as long as you can without breathing because now you're raising your carbon dioxide levels and you do that over and over and within most of the time within 5 minutes you start feeling your nose opening back up. It
Interesting.
all has to do with carbon dioxide. So there's stuff out there you can do. You just got to be motivated.
And you got to look for it. What about at night, essential oils like eucalyptus in
Oh,
a
yeah.
humidifier next to you?
Those are all good things. You bet. You bet. Anything you can do to make it easier to breathe is a good thing. The hard thing is when you get a real cold, that screws your sleep up more than anything because you can't breathe through your nose when you have a cold.
And that might be a time where you can use medication because you're
Mhm.
sick.
Yeah, and like decongestants. So the problem with decongestants is if you use them day after day, you can get a phenomenon called rebound. Rebound is where the nose swells versus stays open from the decongestant.
Will this that you talked about, the clear,
I've
is
only
that
had
habit forming or?
I've only seen one patient over the 7 or 8 years I've been recommending this product. I've only seen one patient who literally came back and said, "That makes my nose get stuffy." One. So you can use that one pretty much all day, every day, and it won't create that. There's another product in Clear that does have a 12-hour decongestant, but they say that it's chemical wise, it's like the product called Afrin, but they say it's about half the dose of Afrin in it. Works really well. I like it, but I can't use it more than twice a week. Or I experience rebound by the next day around 2, 3 o'clock in the afternoon. My nose just, and then I have to do the nose clearing exercises to open it back up again. And that's rebound. So I personally have to be very careful with that. And I tell this to my patients. I start them with the clear and the 12-hour, and I tell them to alternate them every other night. If they don't have rebound problems, we stay on that. If we do, then they got to back off that decongestant or try another one that's chemically different, Flonase. And my ENTs love Flonase, and I've learned more respect for it. It opens the nose. It's a great product. But it just, if you overuse anything, it's usually not good. So I just tell my patients to see what's working, what isn't. But if we can't get that nose open through nasal protocol, and you might be able to manage it that way. And a lot of my patients can manage it through that, nasal dilators, whether they're inside, outside, all of that before bed. Then they put their appliance in, whether if they're a sleep apneic patient and or my pain patient or upper airway resistance. We're still working with an oral sleep device because we're controlling that airway here and here. Because we got 2 airways. We got a mouth airway, we got a nasal airway, but we want the nasal airway. It will give you your best night's sleep. It will slow down the clenching and grinding versus mouth breathing and then clenching because of carbon dioxide and oxygen levels that aren't proper. That's the whole airway thing that we've been talking about. It's not all about apnea in my world,
Right.
but we look for it because it's very prominent.
And one other sleep hygiene question. The temperature of your room,
Mhm.
is that important?
They say cooler is better. Cooler is better. Dark is better than light. Some people, I guess there is a sleep disorder of kind of the eyes being partly open. I don't remember what that's called, but um, so a dark room, a cool room is good. Yes. Pillows, there's lots of different pillows out there. You just got to try this, that, and the other thing. There's wedges you can stick behind your back that'll help you stay on your side.
I've heard of people taping balls to their back.
Yep, tennis ball. You can sew in a little thing in your shirt or tape it or whatever. That might help you stay off your back. Stomach sleeping is terrible for the neck, but a lot of people do it. It's really terrible. That's one of the worst things for the neck, and even the TMJ. If you think about it, pushes the jaw sideways. It's just not good. Stomach sleeping's awful, but a lot of people do it. Can't get over it. But you could put a ball here and then, yeah, maybe when you turn over, it would stop you and you'd flip back over. Because when you're unconscious, you don't really know what you're doing. You could be flipping all over the place and not even know it. But if you always wake up on your stomach or you have to go to sleep on your stomach, then there's something going on. So,
If a person does not remember the last time they dreamed, is that of significance?
Mhm.
You're supposed to remember, do you dream every night? And are you supposed to remember that every day?
I'm not going to sit here and say every day, but you should remember dreams. You should be able to tell me, yeah, I know I dream. I dream. I can't tell you if it's every day, but I know I'm dreaming every week. I have dreams. If you can't say that, then you put that together with I snore, tired. It's another thing in there that tells you you're not getting REM sleep. REM sleep develops over the night. You have smaller amounts of REM sleep when you first go to sleep. And then through the night, you get more and more REM. And the reason you remember a dream is because REM sleep happens right before you wake up, usually. You usually wake up out of REM, and that's why you can remember a dream. So if you're not getting good REM, that's probably why you don't remember your dream, because you aren't getting much before you wake up. You're in deep sleep or you're in light sleep or, whichever one you're in there, but it's not dreaming sleep. That's why you don't remember your dream.
Are there any substances that actively block REM sleep?
A lot of antidepressants mess with REM. Mess with REM. Yeah. And there's a lot of different antidepressants nowadays.
I mean, that just is counterproductive.
Well, it can be. Yeah. In other words, the only thing you can do is say don't take your antidepressant at night. Take it in the morning because hopefully it's kind of wearing off by night and you'll sleep better. That's one thing you could do. Or change the antidepressant because some are worse at that than others.
Would you
So,
expand on that?
um, there's a drug, there's different forms of drugs. They're called SSRIs. It has to do with serotonin levels. Depression, a lot of times, our serotonin levels are low. Serotonin levels, believe it or not, the highest in the body, the most serotonin is actually made in the gut.
Yes.
So if you have leaky gut, which lots of us do nowadays, you will be low in serotonin and your sleep may be poor. Serotonin levels are really important. So now when you start taking these drugs, it promotes that, but there's other stuff in these drugs, and I don't know all those particular chemical makeups of that. I just know that it can mess with your REM sleep. And there's some that do, and there's some that don't. So it's a factor we look at and we talk to the docs about, and we say, hey, you know what? We'd like to try. Could you try something different with this patient? It's going to be up to them and their doctor. It's not up to me. And I don't get into that too much, quite honestly. If we get the airway open, a lot of that just improves. It's amazing. But if they'd work with their diet, because you can be slender and have a really bad diet too, and a leaky gut. But leaky gut leads to all kinds of stuff, autoimmune disorders, um, the depression, all of those things. So, and migrainers, a lot of times have leaky gut, systemic migraines. There's a difference between a systemic migraine and a muscle tension migraine. So the clenching thing, there's two types of headaches that can happen from clenching. One is a true migraine, which is the vessels of the meningeal layer of the brain get inflamed. That's a true migraine. And that can be caused by different triggers. If you've ever had a migraine or know someone with migraines, they'll say, well, when I get dehydrated, it just is trigger for a migraine. Certain foods are triggers for migraines. So there are systemic triggers for migraines. But clenching is can truly cause that type of migraine through one of the nerve branches of that trigeminal system that we talked about with the muscles of the face, the jaw joint, innervates all these different things, right? The tongue. And one of those branches actually passes from the face up through into the brain, up to that layer of vessels, and can stimulate that through the clenching. And so there is a true clenching migraine that becomes a true migraine, it can be a trigger for a migraine. So, like if you wake up in the middle of the night with headaches, good chance it's the clenching that, but it might be a true migraine. You might have an aura, you know, you got to turn off the lights, you got to go to bed.
Well,
True migraine.
and if people are taking Advil PM, they might not feel the headache that's there.
They might feel better because of that. Yeah, because it's not
Well,
only an
it's also a painkiller.
right, it's an analgesic. Yeah. It's helping with that too. But if you're regularly waking up with stuff like that, that's a big red flag. Whether it's apnea or clenching or both, could be, most likely is. And you know, when people come into me with the headache as the primary symptom that they want to get rid of, what I tell them is, okay, so what I don't know, looking at you in front of me, is how much of your headache is because of the clenching. So if we control that, we're either going to find out that it's all of your problem, or your headaches are reduced by 50% or 80% of the time. You don't get a headache anymore because you now wear this appliance at night. We're controlling the airway. Hey, life is good. If you have a headache every day versus a headache twice a month, that's an
a win.
improvement, right? That's a win. So I love that. That kind of stuff excites me. So, yeah.
Well, I think this is a good stopping point, unless there's anything else that you want to add.
No, I could talk all day. There's so much to it, and there's other things too, but we've really hit the big things. We
Mhm.
really have. But there's, you know, just that there's lots of symptomology that goes behind the TMJ sign. You know, it's not just TMJ. It's really temporomandibular disorder,
Mhm.
which is a conglomeration of different symptoms that a patient can have, is really what it is. Produced by clenching and grinding, produced by an airway problem. Most of the time. You can have a macro trauma, meaning you're in an accident and you actually damage the joint.
Sure.
There's that. But you can heal that up, and they might not have an airway problem from that. But if they haven't had all of that, it's micro trauma over time to the joint and the system, breaking it down enough that now they start having daytime symptoms in the form of headaches, ear pain, eye pain, throat pain. The actual jaw hurts every time they swallow, every time they chew, things like that.
Well, and you could just have a better lifestyle. You're getting a good night's sleep. You have energy.
Mhm.
If you could figure out whether or not you have an airway problem and address it, your life would just be so much more enjoyable.
Yeah. Yeah. Your quality of life would go
Your
up.
quality of life.
And that's what life's all about, is your quality of life.
Absolutely. Yeah.
Yeah.
Well, thank you very much.
Yeah.
All
This is
right.
fun. Thank you
Me
for
too.
inviting me.
Hey everybody, Jesse Slaughter with the Pursuit Podcast. And we really appreciate the amazing support already that this channel has received. Our social media is blowing up. Everywhere we look, people are liking and clicking and commenting. But what we really need you to do is subscribe to our Facebook page and follow us on Spotify. That's what drives this channel. That's what's going to keep this channel going forever. Tim and Ben are behind the scenes doing tireless editing, working on this to make this come out the way it does, this high quality product that it is. So please go in there, click subscribe, click follow, and make sure that this channel sticks around for a long time, because we truly believe it's doing a lot of great things for our community. But there's many, many other people out there who we need to support. So follow and subscribe today. Thank you.